right, here we go.
Will you please state your name? Dawn Hughes. And what is your profession?
D-A-W-N. Oh.
I'm a clinical and forensic psychologist.
And where is your practice located?
I practice in New York City.
What is a clinical psychologist?
Sure. So a clinical psychologist is somebody who assesses, evaluates, and treats individuals who are suffering from a variety of ailments or problems that they have in their lives. It could be a major psychiatric disorder, and it could be problems in living. Clinical psychologists also participate in training, in education, and in research ventures.
Okay.
And what is a forensic psychologist?
Okay.
So a forensic psychologist is someone who applies the science and principles of clinical psychologists to a particular legal question at hand.
And please describe your background in terms of your education, please.
She looks like a Karen.
So I
What do you
received my
mean?
bachelor degree in psychology from Hamilton
on.
College, which is in upstate New York. I then received my master's degree and my PhD from Nova Southeastern University, which is in Florida. I then had to complete my year-long internship, and that was at Yale University in the School of Medicine in the Department of Psychiatry. And there I did 2 full-year rotations. I did a year rotation in the Substance Abuse Treatment Unit and another year rotation in the West Haven Mental Health Clinic, where we saw individuals suffering from a wide array
So she's a real one.
difficulties and psychiatric illnesses.
Okay.
After that, I had to complete my postdoctoral fellowship, which is another year that's required in order to get licensed. And that was back in New York at Cornell Medical College in the Anxiety and Traumatic Stress program there.
All right.
Please describe your training and experience in psychology and trauma.
So my experience in trauma has been predominantly throughout graduate school. I started at a domestic violence program that was housed within our community mental health center of the university. And that program, we saw both men and women who were coming through the program. The majority of the men were court-ordered for batterers intervention programs to participate in mostly group therapy.
Yeah, she should have seen Johnny.
Because of their behavior in intimate partner violence, domestic violence. We also treated the female victims who were victims of intimate partner violence mostly in individual therapy, but we did run some groups there as well. After that practicum experience, I went to work at the Veterans Administration in their outpatient psychiatry clinic. And in that clinic, I treated mostly, this was Florida, so they're much older adults. So we saw a lot of Vietnam-era veterans and actually World War II veterans in that program, and a few of veterans who served combat in the first Iraq War. Sort of overlapping in that time, I also was the research coordinator for the Child Sex Abuse Survivors Program.
Oh,
and that
my
was
God.
also a treatment program that was housed within that same community
That's some
mental
shit I
health
would not want to
center.
fuck with. Like, oh
and
my
we
God.
saw individuals, both men and women, who were coming for treatment to deal with the consequences, the psychological after effects of having been sexually abused as a child. After that, I completed my internship when I was at Yale at the substance abuse program because we know there's a high concordance, a high rate of trauma-based disorders with substance abuse. I put together a group, a women's group of female heroin addicts, recovering heroin addicts who also had either domestic violence or childhood abuse histories. So we did a dual substance abuse harm reduction model
Jesus
with
Christ.
the healing from the traumatic effects of the violence that they experienced. On my postdoctoral fellowship, I was in the Anxiety and Traumatic Stress program. As the name sounds, we saw individuals who were suffering from trauma-based disorders and anxiety.
That makes sense.
Mostly late adolescents and adults, men and women, from sexual assault, violence. Some were simple assaults on the streets, being mugged, and things of that nature.
What are they zooming in on her
I
for?
also did teaching and training for Victim Services, which is New York City's largest victim-based organization who runs a lot of services for victims of domestic violence and shelter-based programs. And I did some education and training for them and teaching for a number of years.
Thank you. Let's talk about your current occupation. What positions do you currently hold?
So I currently have a private practice in Manhattan, and
that
I
nice?
also have a faculty position at Weill Cornell Medical College. I'm a clinical assistant professor of psychology in the Department of Psychiatry there. This is what we call on the voluntary faculty, which means you don't get paid, but you participate in bringing in the interns, selecting the interns for that year. In that program, I teach, I think for the past 7-8 years, the ethics seminar to the interns, and also participate in other didactics that they have. I'm also called upon to sort of troubleshoot difficult scenarios that clinicians, either trainees or full-blood clinicians, might have. If there's an issue of intimate partner violence or child sex abuse and they don't really know sort of what to do in that situation, I get consulted to do that.
That's nice.
And then most recently I was part of our program's COVID response team.
Imagine having to fuck with that for a living, though.
Pretty much
oh my
March,
God.
April, May, June, July 2020, where
No
New York
shot.
City was the epicenter. We sort of mobilized and were really doing psychological first aid and helping our hospital-based workers deal with the stress and the trauma from seeing so much death and destruction because of COVID in those first months of New York City's COVID wave.
What does your independent practice entail?
So my independent practice is predominantly, I say 3 things. The bulk is I see individuals in therapy, 2.5 days. I see people who come to my office who are mostly
Still
dealing
flexing?
from,
Yeah, I know.
You know, the traumatic
let's get to the actual
victimization,
content. Like,
childhood
holy
abuse,
shit. Like,
rape,
I get it.
sexual assault, sexual harassment,
I understand.
domestic violence. And I see these individuals in therapy. I do have a percentage of individuals who do not have a trauma history, and that's usually the anxiety disorders that I see. They may have panic disorder or generalized anxiety disorder or other difficulties and just relational difficulties or problems in living. The second big part of what I do is this, forensic
just establishing
psychology,
a narrative?
like
Yeah, I
I'm
think
doing
so.
here today. I evaluate individuals who were involved in legal matters. I consult with prosecutors and district attorneys and U.S. attorneys on their cases, and just something that has to do with the legal system. And then the other smaller percentage is the engagement in professional activities in the profession.
Okay.
Do you have any areas that you specialize in?
Yes, I specialize in interpersonal violence and traumatic stress.
And what is interpersonal violence?
Oh,
So
shit.
interpersonal violence is the umbrella term
Here we go.
for when one person does something violent or abusive toward another. And that includes domestic violence, childhood sexual abuse, rape, sexual assault, sexual harassment,
The bad shit.
physical assault. All of those type of behaviors we understand as interpersonal violence. And then the traumatic stress is the consequence of that. What happens to individuals when they experience these sort of life-altering events, these really adverse life events? Traumatic stress is one of the outgrowths and the psychological consequences that people have.
It's playing
when
Warcraft
they've been
Rumble. Yeah,
exposed to
true.
these type of traumas.
So intimate partner violence, rape, and sexual assault are major areas of your focus of practice?
That's
Is that
correct.
fair to say?
Objection leading.
Oh.
I'll sustain the objection.
Okay. I'll just move on.
Call it
What
how you
types
see
of
it.
patients do you treat in your private
Yep.
office?
So I treat adults, mostly men and women in my practice. I sometimes will treat late adolescents, 17 or 18. They'll come to me usually after a rape or sexual assault, and I'll treat them in short-term treatment. But mostly adults who are, have sustained some kind of traumatic event in their lives.
Approximately how many victims of interpersonal violence have you examined or personally interviewed over the course of your career?
Hundreds upon hundreds.
That's a lot.
And how many years have you been practicing?
Well, I started practicing in graduate school in 1992, and I was licensed in 1996, so 25, 30 years.
Okay.
That's a long time.
Are you board certified?
Yes, I am.
Please describe to the jury what board certification means and what you are
See, they're trying to get all these credentials.
Board certification is the highest degree of postdoctoral.
They're trying to get all these credentials
certification that
where
a psychologist
it's like,
can
oh,
do.
wow.
And I am board
It's like all your
certified in
titles
forensic
from the king of Game of Thrones
and
to
that
like
means that I
establish
have to
credibility.
surpass,
And then they're going to have her talk about some
area
bullshit. Get ready for it.
psychology.
Watch.
And are you licensed to practice? And in how many states?
Watch. This is what's going to happen.
I'm licensed in 3
I'm pretty
states,
sure it's what's
in
going to happen.
New York,
I don't know.
North Carolina, and Connecticut. And then I have some temporary licenses in other states as well.
Okay.
Have you published in the area of your specialization?
I have. I am
Holy
not
shit.
predominantly a researcher or
We
somebody
get
who
it.
writes. I'm a clinician. I'm doing
We get
direct
it.
clinical service. But over the
She has
course
authority.
of my graduate school and postdoctoral time, I have published some things, yes.
And have you published a book chapter relating to rape and sexual assault?
Objection
have.
leading.
Oh.
Overruled.
Yes, I have rape and sexual assault in adult women.
And have you published any book chapters relating to structured or clinical assessment of risk or violence?
Yes, I co-authored a book chapter entitled, this is a Structured Clinical Assessment of Risk and Violence.
Okay.
Have you given any other trainings or presentations to mental health professionals in the area of trauma and abuse?
Yes, I've given many trainings at national conferences, at legal conferences for attorneys, for mental health professionals, on understanding trauma and how trauma may show up in the courtroom, on understanding what a victim of intimate partner violence might look like, of understanding the difficulties that a rape victim might have to come into court to testify.
Okay.
And training just regular sort of mental health professionals on how to understand trauma, how to
Okay.
look for trauma.
Got
What
it.
does it look like when it comes into your office? How do you
We
treat
see it.
How
It's
do
on
you
the right
assess
side of the
it?
screen.
All of those factors I've done a number of trainings on.
Have you been invited on any occasions to train attorneys and judges on trauma and violence?
Yes, I have. I was invited by the Judicial Conference to be part of the training curriculum to train our New York State Supreme Court justices on issues of intimate partner violence and
Okay.
traumatic stress. Some
That's
of the
good.
things that I've just been talking to you here about how to understand what happens in those situations, how to understand the myths and misconceptions that may abound in these situations, and how you can sort of more accurately understand what a victim is talking to you about and telling you when they come into your courtroom.
Have you given any presentations to judicial symposiums on domestic violence?
Oh, now
Yes,
we're
I've
getting
also
into
been
music.
contacted
Oh, great.
by, sometimes judges will have symposiums in their courtroom. They will make a decision to hold a particular symposium on particular topics, and I was, asked to come to
Even Amber's
presentations
getting
for
bored, and it's
judges
her
on
own.
numerous
It's her own
occasions.
fucking person.
And what, if any, presentations did you do on understanding women's use of force in IPV?
Oh, here we go.
That was a recent presentation. I think that was invited by one of the judges of the Office on Domestic Violence in New York. And the title is When Women Use Force in Situations of Intimate Partner Violence. And my topic was to talk about the complexities of that issue. And what does that look like? And how can we differentiate if both people are fighting? How do we know that this is intimate partner violence? So what does the research tell us about that? How do we understand that? And how can we really accurately assess that?
Here we go.
That was sort of the bulk of what that training was about.
What professional organizations do you belong to?
I belong to a number. I belong to
both.
The
Yeah,
American
I
Psychological
don't like where
Association,
this
which
is
the
going.
largest body of
I have a feeling
psychologists,
where I know where this is going. I don't like it.
in the United States, over here, headquarters.
Yep,
in
I don't
DC.
like it.
Because it's so big, there are subdivisions of of American Psychological Association. So I belong to the division of trauma psychology. I belong to the division of psychology and the law, the division of psychologists in private practice. I belong to other organizations, the International Society for Traumatic Stress Studies, which, as the name says, it's an international society where we
I would have never guessed that.
interdisciplinary, mostly psychiatry
I thought it was
and
a Burger
psychology,
King.
researchers and clinicians to really understand and further our awareness about trauma.
I thought we were
traumatic
I thought we were talking about
I
Burger
belong to
King,
the
man.
International Society for
Shit.
Trauma and Dissociation.
This changes
I belong
everything.
to the Anxiety Disorders of Association of America. I'm a fellow in the American
his
Board
face.
of Forensic Psychology. I don't know if I'm forgetting any.
He's just staring at the
Are
camera.
any of these specific to interpersonal violence or trauma?
Jesus.
Well, clearly the trauma division of the American Psychological Association, the International Society for Traumatic Stress Studies, and the International Society for Trauma and Dissociation. And then also the Anxiety Disorders of Association continues to talk about trauma because prior to this new DSM-5, PTSD was originally categorized under the anxiety disorders. So there are still colleagues and researchers in the anxiety disorders organizations who talk about PTSD and trauma.
I'm so worried that she's going to say
Do you
it's...
hold any leadership roles in these organizations?
Yes, I am currently the president-elect of the Trauma Division of the American Psychological Association. That is an elected position. You have to be elected by our membership.
Okay.
And now I serve as with the presidential
She's going to make it look
trio,
like
so
it was
there's
a...
three of us. You serve with
It was
the
like a back and
past
forth
president,
with like her and Johnny.
the current president and the president.
That's what I'm worried
so
she's
it's a
going to do.
3-year term. And what we try to do is continue to disseminate
y'all
best
see what I'm saying?
practices in trauma psychology and also interface with the larger American Psychological Association organization.
Johnny's on Warcraft
to
Rumble. He doesn't give a
continue
fuck.
to disseminate best
He
practices
doesn't
and
give a
have
fuck.
just a voice for trauma psychology with our larger
This whatever.
body and policy making. I've been involved in the Trauma Psychology Executive Board since its inception. I was a founding member of that division. I served as a membership chair, a program chair, an awards chair. I was the APA Council of Representatives, which means I was also elected to serve a 3-year term and sit on the governance board of APA, representing the Division of Trauma Psychology. So
That's
I've been
incredible.
very actively involved in the trauma division.
I can't believe it.
And what is the Division of Trauma Psychology?
I
So the
wonder
Division
what
of
that
Trauma
could possibly
Psychology
be.
are psychologists
How could
who
anybody
come
know what
together
that
who
is?
want to disseminate best practices in trauma psychology. We want to make sure that we have our finger on the pulse
If I was in the
of
jury,
research and evidence-based
I'd vote
interventions
Amber
for
guilty
people who are
just
struggling
for this
with
woman.
traumatic events that have happened to them.
Like, I want to vote her guilty just for this
Have
one.
you
I'm so
served
tired
in
of this.
leadership positions of
Tired
other
of hearing about
professional
your fucking
organizations?
accolades.
Yes, I was. There's a New York City-based organization. It's called the Women's Mental Health Consortium, and that's also an interdisciplinary organization. It's psychology, psychiatry, nursing, social work, and this was formed in order to give women sort of a referral base and more information about mostly like reproductive psychiatry. We know that certain difficulties and psychological difficulties that you have can erupt when you're pregnant or postpartum. So we wanted to have a
Amber's not
number
pregnant.
of resources available to women in the New York City area. I was a membership chair there for a number of years, and then I was the president of that organization, I think 2009 to 2017. I don't have my CV, but I think that's about right.
Okay.
Why is participation in professional organizations important in your field?
Well, it's important to me because I do believe very much in service. I do believe very much in giving back. I do believe that it's important as a psychologist who believes strongly in trauma psychology and helping people that I can be part of a voice at the table, part of that push to get policy and understanding, especially with the insurance companies, to make sure that people are getting, the appropriate care that they deserve.
That's
so
incredible.
It's something that just has always been part of my
Wow.
life in varying degrees. And as a psychologist, I feel like it's a very rewarding part of my job.
So true.
Do you attend professional conferences?
Yes, I do. Typically
Thanks.
multiple times a year. Of
What
course,
did you
COVID
have
threw
for
a little
lunch?
bit of a wrench in that, since some things are virtual. But yes, I routinely attend conferences.
Do you like Burger
Why do
King
you
or
think
Taco
that's
Bell
important?
more?
It's important to stay abreast of developments in the field. It's important to meet with your colleagues across the country and see what they're doing and what they're hearing
Would
and
you
what's
rather
working
fight
and what's not working. So when you're
100
at a
duck-sized
conference and
horses
somebody's
or
presenting
one
new or novel
horse-sized
research,
duck?
then you can take that information and bring that back to your clients and bring that back to my forensic work. So it absolutely enhances the work that I do.
That's
Have
crazy.
you ever been qualified to testify in the field of psychology as an expert witness?
Okay, I think this
Yes,
is
I have.
all right.
How many times?
All right, we're coming around to the
I
point.
was first qualified in 1998, so since then, about 50 times.
That's a lot.
And how often in that 50 times has the specialty been in interpersonal violence and traumatic stress?
Probably more than half.
Okay. Have you ever worked for or testified for the prosecution in criminal matters? like the district attorney's office, U.S. attorney's office?
Yes, I have, frequently.
Imagine her saying this 50
Do you
times.
testify for both sides in lawsuits, plaintiffs and defendants?
Yes, I do.
Have you ever worked on other cases that didn't go to trial?
Many.
Okay. Have you ever
Okay.
found an individual that you evaluated did not suffer from the effects of interpersonal violence or PTSD?
Frequently.
Good. Good.
Have you ever not been qualified in court where you have been proffered to qualify as an
It's
expert
good
in
that she
court?
said that.
No.
Your Honor, I would at this time
she didn't-
move to qualify Dr. Hughes as an expert in forensic psychology with a specialization in interpersonal violence and traumatic stress.
All right, any objection?
No objection to qualifying her as an expert in forensic psychology.
All right.
More specifically, forensic psychology
True.
with a specialization in interpersonal violence and traumatic stress.
Yeah, he's like, please. He stands up just like, all right, let's
All right, so
go.
moved.
Thank you, Your Honor. Dr. Hughes, please tell the jury what domestic violence, intimate partner violence means.
Sure. So I'm probably going to be interchanging the language, domestic violence and interpersonal violence.
Okay.
And for purposes here, these are the same thing. So intimate partner violence is a pattern of manipulation, fear, and coercive control that happens within
Yeah,
an
zoom in
intimate
on her.
relationship. It constitutes using a variety
Yep.
of abusive behaviors.
Uh-huh.
And that can be physical violence,
True.
sexual
Yep.
violence, psychological
Based
aggression,
cameraman.
emotional abuse.
This cameraman, oh
stalking,
my God,
surveillance
what a legend.
behaviors, and economic abuse. The abusive behaviors occur over time, not all at once.
That's right.
And they're also interspersed with very normal times, times without violence, times with love and happiness. And it's this interpositioning of the violence with the love and the abuse, with the love and the care, that makes it very difficult.
I think she's mad
for
now
a victim to
that they're
extricate
looking at her.
herself from that situation and from that relationship.
She's trying to drink something and make
And
them
what
go
would you
off
say
of
is
her.
the overarching dynamic of these relationships?
So the overarching dynamic is the abuse of power and control of one person wanting to have dominance in that relationship, say over
Yep.
most things that the couple or that the
Bro,
victim
this
does or does
cameraman.
not do.
Oh my God.
Please tell the jury what coercive control means.
This fucking
Coercive
cameraman.
control is a tactic of victimization. The goal of it is to establish dominance.
Yep.
What coercive control does is that it imposes negative consequences for
Fake cry?
noncompliance
I
with
don't know
your
about
partner's
that.
expectations or demands. And what that does is it erodes away at the victim's autonomy and her independence.
Her?
What is physical
What do you mean,
violence?
her?
So physical violence is when one person uses their body against the body of another with the intent to cause injury or harm. That can be push, shove, slap, kick, punch,
I'm mad.
beat up,
I'm
maybe
mad now.
multiple types of physicality in one instance.
You mean like all the
Throw,
things that she already
slam
did?
into a wall, push into something hard that you could hurt yourself. Clearly, use of a weapon would be a physically violent act as well.
Does size and strength matter between the parties?
Yes, very much so. This is very well
Leading.
documented in the literature
Object
about
that. Like,
violence and abuse
bro.
in relationships, and that's just physics. That's just proportional
it's such a
force.
leading
That
question.
A 185-pound man is going to push a 120-pound woman. That's going to feel quite different than a 120-pound woman pushing a 185-pound man. And it's just about proportional force and the size
I'm mad.
and strength differential.
Oh my God.
And that is why specifically, if you look at wrestling or boxing, they match weight classes. And they do that for a reason, because they know that it's not fair if somebody is bigger and stronger than the other. So it's certainly not the only factor, but it is a factor
That's not what
that
they're
one has to consider if a relationship is violent.
That makes me so mad. Like, this
What
is
is
such fucking
psychological
bullshit,
aggression?
man.
So psychological aggression is threats and the imposition of threats with the intent to control someone's behavior. So
This
it's
is-
doing a threat so that you will modify your behavior and do what your partner wants. Some psychological aggression techniques
See, they're
are
trying to,
intimidation.
make it equivalent.
Slamming your
It's like-
hand on a table, punching a wall, throwing something, mumbling under your mouth, cursing, screaming, sort of these high emotional balance type of activities that can cause a victim to feel afraid and feel intimidated. And then if there has been an act of physical violence where that contingency has already been established, that this person, your partner, has said, okay, I not only have the ability to use violence against you, I also have the willingness to do it.
I wonder who
the
that
intimidating tactics
W
take on
cameraman, by
greater
the way.
flavor. They take on greater salience. They mean more because you know what could be coming down the pike.
What is emotional abuse?
So emotional abuse functions to denigrate a person's sense of self-worth.
They're getting
and
her to
their
establish
self,
this?
So
they can equivocate
it's about
Johnny maybe being rude with her hitting him.
Spirited, putting yourself
Watch, that's
down,
what's going to happen.
using gender-based
They're building a
language that's
house.
offensive, racial slurs, all types of behaviors to really make a person feel less than they actually should.
And what is sexual abuse?
So sexual abuse in an intimate relationship functions to establish dominance and establish power. What it is simply in the psychological and psychiatric communities is forcing someone to do something sexual against your will when you did not want to.
That seems obvious.
It can be forced sex, either forced vaginal, oral, anal sex. It can be forced to engage in any other type of sexual act that you may not want to do. And when I say forced, it doesn't mean it has to have physical force. There's a lot of psychologically coercive tactics that are used that many times when violence has already been established in the relationship,
you don't need
the
to be
victim
violent.
often feels that she can't say no for fear of reprisal, for fear of
That
retaliation, for saying no to those acts. So sexual
can we
abuse,
get an objection
does
in the
happen
court?
In intimate partner relationships. A lot of people don't want to talk about it, and they don't want to ask about it because it makes people very uncomfortable.
Is digital penetration of the vagina sexual abuse?
Digital? Wait.
Leading.
What, if any, role does digital penetration of the vagina
Wait, digital
play in sexual abuse?
What?
If it is non-consensual, then it is abusive.
What, if any, penetration of inanimate objects?
Oh, a finger.
into the
Oh,
vagina
like your
plays a role in
digit.
sexual abuse?
Again, the operative word is consensual. If you are not consenting to those acts, then it is sexually abusive.
Is there a distinction between sexual violence and sexual abuse?
Not really. Sexual violence is a term of art. It is the overarching umbrella that we in the psychological and psychiatric communities talk about.
Oh my God.
So if we are looking at our diagnostic and statistical manual and say what are the traumas that could cause PTSD, it's listed as sexual violence. So it's an umbrella term that allows us to understand it could be childhood sexual abuse, it could be a rape, a sexual assault, it can be sexual abuse in an intimate relationship. So it's really just an overarching term that we use in the field.
What are
So it doesn't mean, I think people often mistake it to mean that when you are being sexually abused, that someone's punching you or someone's hitting you or someone's doing something like that because you feel violent. It does not mean that.
Nobody thinks that.
That could happen, but that term does not require that, nor does it mean that.
What are stalking or surveillance behaviors?
So stalking and surveillance behaviors are a common tactic of typically men who use violent behaviors in an intimate relationship. What they do is they allow the woman to know that wherever she is, wherever she goes, he's going to know. I'm going to maybe look at your phone, see who you're talking to, track you on Find My iPhone, look at your Instagram, look at your emails, really having a way of knowing all of the personal information about you. And what that does, it again erodes the victim's autonomy and it erodes her sense of privacy. She doesn't feel that wherever she can go, that somewhere he's not going to be part of her life in a very objectionable way. Sometimes there's the pop-ins. They'll show up at places that they're not supposed to be and that we don't want them to be, just as a way of checking. Sometimes they'll have friends or family check up on their partners to make sure where they are. What time did you get home? But you didn't turn off your phone at this time, but you came in the door this time. Like all of the sort of constant questioning and interrogation about an individual's whereabouts.
What about economic abuse? What is that?
So economic abuse is a way to, again, continue to maintain control over your intimate partner. Sometimes it's withholding information about the finances, of not letting you have access to the finances. If you can't have access to a credit card or a checking account or, you know, Apple Pay on your phone, then you're rendered usually much more economically dependent on your partner, and that limits tangible options for you. For individuals where that sort of tangible options isn't there, we see the economic abuse or the economic restriction when one partner refuses to share any information about the funds. So it's not like I can't go shopping because I won't have money, but I don't have any decision making in our family money. I don't have any idea of what we're doing in our family vis-a-vis our finances. So it's a way of definitely keeping that very separate and not in a consensual. Some couples make that choice. One person does all the money, that's fine. But when it doesn't come from a place of consensual choice making, it can be abusive.
So you just described a number of these abusive behaviors. Are all of them present in every domestic violence relationship?
Right. No, they're not all present in everyone, and that's why it's very important to do a thorough assessment of a relationship that may be mired in violence to see which ones are present and which ones have a great impact in the relationship, which ones are sort of making the structure of this relationship.
Oh my God.
After a sexual assault in an intimate relationship, how might a victim in those circumstances interact with her partner?
So this is one of the myths that people say, well, if she was sexually assaulted by her partner, she would have just left. And nothing could be further from the truth. That's not what happens, especially when it's your husband or your boyfriend or your partner. So what women do is they bury it. They compartmentalize it. They put it away. They avoid it because then they continue to reach out for the kind and the loving man that they got into this relationship with.
I'm glad that people get to see this. The problem is that it does
fester belief and causes
I'm glad they get to see this.
Psychological distress in the victim.
Everybody sees exactly what's going on here.
What, if any, role can shame or humiliation
Everybody gets to see
in this coercive dynamic?
Yep.
So that's one of the emotions that
what a bunch of
the
fucking
victim
bullshit.
is usually trying to suppress and compartmentalize and avoid and put away. One of the most frequently felt feelings after something so incredibly humiliating and violating is shame. And shame is a very sort of difficult emotion for people to have to live with and to have to experience. And then a lot of times what we see in these relationships, especially ones where sexual assault is perpetrated, there's typically the emotional abuse as well. So now if you're called names like a whore and a slut and easy and fat, and you're feeling the shame from the sexual assault that just happened, it sort of acts as a compounding effect, and it sort of kind of slowly deteriorates the psychological functioning of the victim, and where they're just really trying to get back to the good guy, get the good guy to come back.
The guy.
But they're suffering these symptoms
oh my
underneath.
God, how's this?
What about intimidation? What role does intimidation play in the coercive control dynamic?
And intimidation is one of the huge factors that we see in coercive control. Again, the goal is to get your partner to do what you want them to do.
Yeah, didn't she call him a fat old man?
You can use violence and other sexual violence.
Yeah, I fucking forgot about that.
Slamming your hand on a table, throwing a glass, breaking a door, throwing anything, causing a fit, yelling and screaming. That can rise the fear level in a victim that she may modify her behavior quicker, and he might not need to use physical violence.
Oh my God.
Because he's already established that fear is
How
there.
is this?
What, if any, role could writing obscene messages play in being considered intimidating behavior?
Objection leading.
True.
What, if any, Your Honor?
Shut.
I mean, certainly writing obscene messages to your partner could absolutely be an intimidating behavior.
Duh.
What, if any, role does emotional abuse or degradation play in the dynamics?
So emotional
calling him
abuse
a
and
fat old
degradation,
man?
as I stated before, functions to decrease your sense of self-worth. It decreases your sense of agency. It makes you feel bad about yourself.
It
and when
sure
you feel
did.
bad about yourself, you're less likely to actualize and see options for leaving. You're so sort
Until
of
she
mired
shit in his bed.
in this dynamic of abuse
That's
that
exactly what
you
happened.
come sometimes to believe the bad things that the person is telling you about. So, you know, maybe I am not talented and fat and lazy and stupid, and it interferes with that ability to problem solve and figure out, you know, can I get out of this relationship? And sometimes you feel you don't even deserve to get out of the relationship.
Luckily he did.
When the abuse is so chronic and so repetitive.
Is that Amber Heard's mom?
What role does surveillance as a means of control play in that dynamic?
Bro, this is
So
so
surveillance-
fucked.
Objection leading.
I don't think that's leading, Your Honor.
Overruled, go ahead.
So surveillance functions to let the victim know wherever you are, there I am. So it makes her feel not secure in her movement, feeling that she has to restrict her movement. Her movement is not hers alone. It usually increases hypervigilance. It increases fear. It increases
Oh my God.
the need to for yourself to mark where you've been and what you've done so that you can go back and prove it to your partner, because you know that there is going to be an interrogation later. When this pattern has been established, show receipts, you know, show me your iPhone, where were you, what's your Google location at? You know, those are some types of surveillance behaviors that puts the victim very much on edge and increases that level of anxiety and trepidation.
What
Yeah.
role does possessive jealousy play in these relationships?
So possessive jealousy is a very difficult
Like making him
dynamic
leave his
in
financial
intimate
meeting to
partner
be with
violence.
her?
It's very common in
Like that?
situations of coercive control. It's rooted in possession.
Remember that?
The gentleman feels that he can possess her and that he
Oh
can
my God.
have her whenever he wants. It's very possessive dynamic. But the accusations, the problem is when you make the accusations, the woman's forced to refute the accusations. So they're continuing in this dynamic where she's trying to prove, I didn't do what you said, this didn't happen. And then unfortunately, sometimes it escalates because the man is not taking the no for an answer, because this is a perseverative
How is this
excessive pattern
happening?
that's very difficult to penetrate, that often these type of conversations lend themselves to physical and sexual violence.
Does this dynamic happen overnight?
No, it doesn't happen overnight. It happens over time. You know, we don't, you know, a woman doesn't get into a relationship with a man who's
Yeah, obviously it
beating
happens
her
over
up
time.
and
That's
sexually
true.
assaulting her and calling her names and doing all that. You know, she gets into the relationships for all the right reasons, just like we all get into
I'm
relationships
just so
for love,
fucking-
for companionship, for kindness,
It's
for a
so
future.
shameless.
But then slowly, you know, all of these behaviors start to take form. And I always say it's sort of like sucking the oxygen out of the room, and then before you know it, you're suffocating.
So, and that brings me to my next
Sure.
question. What role do physical abuse and coercive tactics play interspersed with normalcy and positive moments?
Objection compound.
I'll sustain the objection.
Okay. I'll figure this out some way. What role does love and normalcy play in these dynamics you've been describing?
Objection compound.
Overruled. Go ahead.
Thank you.
So love and normalcy are almost always in these relationships. That, you know, when you are in a lull and the violence is not happening, you're back to sort of the loving man that you wanted,
Yeah.
the person who you wanted to be with. And when you pair sort of this violent dynamic, physical violence, sexual violence, with love and attachment, it creates a trauma bond. It creates a psychological bond. An emotional dependency is created. So it makes it very difficult for the victim of the abuse to sort of extricate herself from that relationship.
Bias.
And for her
I
to
know,
even
bro.
believe,
Like, this is so
frankly, I
fucked.
mean, that takes a lot of time to even believe that she can and that she should.
And what, if any, role does that dynamic you've described have in the victim thinking they can fix the problem?
So what do we know from the research? The research with working with battered men who come into treatment is that the only person who can change the abuse is the abuser. So no matter what the tactics that the woman uses, she's trying to do all these different things to fix him, to have him not be violent, to have him not be sexually violent, to have him not be obsessively jealous. And all those things don't change his behavior, because it's up to him to change his behavior. And this was played out a million times in the batterers intervention groups that I led. And the men would tell us, it doesn't matter what she does. I don't care. So the problem is that the woman continues to think that she can fix it, and yet she can't. But she's the one who's then rendered sort of helpless and hopeless because everything that she's trying to do is failing.
What is the cycle of violence?
Oh, this is where they
The
rationalize
cycle
her
of
violence.
Is one way to describe this domestic violence pattern.
Here we go.
Typically what we see, and the cycle can be different in a variety of relationships, but typically what we see is in the first phase, so sort of multiple 3 to 4 phases. In the first phase, there's a tension building phase. You're sort of starting to feel that apprehension. He may be throwing his papers on the table a little more. He may be slamming the fridge door a little more. He may be mumbling under his mouth a little more. He may grab a glass a little more forcefully than he normally is. And then there's the incident phase. Then there's the blow up, where the violence, the abuse, the screaming, the sexual violence or the physical violence, all that occurs. Then we come to the contrition phase. I'm sorry. I didn't mean it. It wasn't me. I'm not going to do it again. The promises for change. And then we sort of slide into the calm phase where, you know, this isn't
Everything's
going to happen
good,
again.
yeah.
I'm back to
And then you're back to
stable
phase
ground.
one.
I'm
I
gonna
get
live in
it.
this place, this sort of honeymoon place. You know, the problem in the calm phase is we often see the rationalizations and the justifications for the behavior. It's not like typically the man is taking full responsibility for what he did, but it's calm because there's no, you know, violence and no sort of tension at that moment.
Okay.
And then it recurs. And then it recurs. So you're stuck in this vicious cycle of trying to figure out, how can I be with this man who hurts me, and yet I love him so much.
Oh my God.
And what, if anything, does the term love bomb mean?
So the love bombing is, it's more of the colloquial
Oh
term
my
for the younger
God.
folks here, but, you know, where you shower someone with affection and love, you know, in this contrition and calm phase where, you know, everything about you is special. You're the best thing in the world. I'm never going to do anything to hurt you again. I would never let anyone hurt you. And it could be sending flowers.
Or how about
and
giving the
buying
person a
gifts,
knife?
or going on trips, or your favorite restaurant. And that is,
about
you know,
that?
a way of where the man is trying to make those amends. And then it gets the woman hooked. So they get hooked on the kindness.
How
They
is
get
this
hooked on the
gendered
love.
language
They
not
don't get
leading?
hooked on the abuse. I've never met one woman in the hundreds and hundreds and hundreds that I've evaluated
I don't understand.
who was not concerned about the violence. They're all concerned
It's
about
so
the violence,
obvious that it's...
but they go for the love.
So, in your experience with these dynamics that you've described, does the victim ever yell at her partner?
Absolutely.
Why?
We know from the research that women use verbal and physical acts of aggression in these relationships. That's not uncommon. This has been researched for 5 decades. And a woman may yell at her partner because she's angry.
Yeah, sure.
And anger is a very normal emotion to having been abused. She can also be afraid, but they don't have to be mutually exclusive. We can absolutely, as human beings, feel 2 or 3 or 4 different emotions at once. You know, people do often say to me, oh, she would never yell at him if she knew he was going to hit her.
No.
And that's not true.
No,
that's
that's-
just
yeah,
patently
it's
not
obviously
true.
bullshit.
That's not supported in the research, and that's not supported in my clinical practice. You know, the problem is there's a classic double bind, and the violence has been so normalized in the relationship now. She gets hit if she does yell. She gets hit if she doesn't yell. So for women who feel at certain moments that they need
He's
to
shaking his
preserve
yeah,
some
true.
sense of their autonomy
Fucking
and their
true,
independence
Johnny.
and stand up for themselves.
What a bunch of bullshit
they will
this
yell,
is.
and they will fight back, even though the risk of
They will
violence
fight
is
back.
there.
See what I was
So
saying?
it doesn't mean that she's
Rationalizing.
not afraid and that she's not concerned about the violence. And it doesn't mean she doesn't also use placating and compliance strategies.
What's the
most of
YouTube
the
chat
time
saying?
As well.
Bro, gender bias Karen.
In the cases that you have, in your experience, does the abuse
True.
typically take place in front of others?
This is horse shit.
No, I mean, this is classically what we talk about behind closed doors. Most of the intimate partner violence, the domestic violence, happens, in the privacy of your own home. So sometimes we see the remnants of it, the after effects, or victims talk to their friends or family about it.
Oh my
but
God.
very rarely are you seeing it happen, the actual blow-up phase happen in the middle of witnesses and other people.
What does the term bystander effect mean?
Oh my God, who cares?
So bystander effect means what happens when people are aware that domestic violence is happening. What happens when they're aware,
It's nothing to
even
do
if they're
with
not
it.
seeing it, that it could be happening. And what happens is we know that it's very difficult for people to stand up and say something. It's very difficult, especially in situations where there's a larger community of folks and the person who perhaps is perpetrating the abuse is the leader of that community. It becomes very difficult to go up against that, to go up against the sort of the head honcho of the community. People are very fearful of losing their jobs. I've seen this time and time again in the cases that I've worked on, either the Boy Scout cases or the clergy abuse cases, all of those type of cases where the USA Gymnastics, where when we go back and we look, we see people knew. But the secretary doesn't want to lose her job. She has kids to feed.
That's
the
always
guy
the way
who,
it goes.
checks you in, he doesn't want to lose his job because
Now they're
he has
trying.
a mortgage to pay.
She's trying to discredit
So
Johnny's
people are
friends.
quiet, and they don't say
You
anything.
see how this happens?
And then other people are
You see what's
very,
going on here?
It's a very worrisome
the game?
dynamic. They don't want to put their foot out there if they're wrong, and maybe I didn't see it right, or I don't really know what happened. I certainly am not going to jeopardize my job if I don't really know
It's
what happened
disgusting,
behind
man. I
closed
fucking
doors,
hate
even if
this.
I see a trashed room or a bruise.
I
And then people
fucking hate this
still
shit, man.
believe
Like,
it's a
oh my
family
God.
matter. It's between Amber and Johnny. Let them figure it out. I'm not going to
This
get
is
in
so
the middle.
fucked, man.
So those are dynamics that happen.
What's the objection?
Motion to strike.
The whole thing.
What's the objection?
We identified 2 names in the answer.
Overruled. Next.
Thank you.
Question.
Did you finish your answer?
Yes, I believe so.
Okay. What about mutual abuse? What is that? What role does that play?
So mutual abuse isn't really a term of art that we use. What we look at is situational couple violence and intimate partner violence. And when we look at situational couple violence, that really does characterize the majority of types of violence and abuse that happens in relationships. That's when a couple gets out of hand. They may push, shove, slap, yell, say some things that they don't want. And it's not that those behaviors are okay, but those are sort of what our larger scale community-based studies say happens in these relationships. That's distinguished from intimate partner violence, what I'm talking to you about, that has this constellation of symptoms and is rooted in the abuse of power and control.
Is there research that addresses this mutual abuse?
Yeah, there's research that addresses what does gender symmetry look like, male and female. Are they the same? And there's certainly, as I said, research that on the lower end types of violent behaviors, push, shove, slap, we may see similar rates between men and women. In psychological aggression, yelling, name calling, putting down, in some of our big community scale studies, we may see similar rates of perpetration.
So all the
of
things
those
that Amber did.
But then there are, other situations where we don't have gender symmetry. And what the research talks about very clearly is you have to examine context. You have to examine the differential of power and control and coercive control in the relationship to make a full determination.
Do women use violence in relationships?
Yeah, absolutely. Again, we've known this for 5 decades in our research. We've been studying this since the 70s. And when we look at what happens, women do report their use of violence. The majority of violence that we do see is what we call reactive violence.
What
or
a bunch of fucking bullshit.
violence,
Wow.
Or sometimes violence that's perpetrated independently of an assault.
Wow.
Or something that's going on. But mostly that when the partner begins to become violent, then she may become violent and fight back.
It's his fault.
And that's not an uncommon dynamic, that if somebody is being
He made
pushed or
me
shoved
hit
or
him.
that a person would fight back. That has been established in the research.
And what, if any, effect does that have on changing the power dynamics or the structure?
Well, you have to
here we
find
go.
out, does it? Does her use of violence change the overarching power structure of coercive control
This is unreal,
and violence
man.
and abuse in this relationship?
I'm
and you
so
have to
mad.
examine those variables to see, does it or
She
does
cut
it
his
not?
fucking finger off.
Can men
Like-
be victims of intimate partner violence?
Absolutely. Certainly, we know that we have to be careful of gendered stereotypes. We can't go in and think, oh, only the woman is the victim and only the man is the perpetrator. That just does not comport with the research. We know that.
It doesn't comport with your language either.
Have domestic violence in same-sex relationships. My very first case was a same-sex domestic violence homicide in Brooklyn. So that was in 1998. So I've been examining and treating individuals in a variety of types of violent contexts. So we have to be careful that that bias doesn't get in our way when we're evaluating a particular situation in a particular case. That said,
What about using
we do know
gendered
that there
language
still
as a
are
default?
differences. You know, in a heterosexual couple, in a male-female dyad, the research still is clear that there are differences. Men still perpetrate more severe acts of violence. Women are still more likely to be injured. They are much more likely to suffer sexual violence at the hands of their partner. They're more likely to be intimidated, afraid, and they're much more likely to be killed. So we know that those differences exist, but we do examine, you know, in those individual circumstances, knowing that either one could be a perpetrator or a victim.
So how are you able to determine whether a relationship is a situational violence or intimate partner violence?
So I thoroughly examine all of those other variables. I look for the coercive control, who holds the power in the situation, who's able to say no, who makes the decisions, what are the consequences if you don't follow the decisions of your partner, is there sexual violence, is there intimidation and fear, are there statistical factors that are associated with severe and lethal domestic violence? So there's a lot of data that we have in the field that we can use to assess a particular relationship and really find out what's going on.
Does alcohol and substance use cause people to be violent?
No, it certainly doesn't cause people to be violent. We have plenty of people who
that's right, it doesn't.
Struggling with substance abuse.
You see that? That's a leading question. Like, how the fuck?
But when you have a substance abuse and addiction,
how the fuck?
And you perpetrate domestic violence, it does create a much more disastrous effect. It is a co-occurring variable, and we know that also from the research that the majority of the women will report that when their partner is drinking, the physical violence goes up. So a lot of the times when he's physically violent is when he's been consuming drugs or alcohol. When he's not consuming drugs and alcohol, he's not violent, those other behaviors continue to persist. The coercive control, the surveillance, the obsessive jealousy, the possessiveness, the psychological abuse. Those usually persist, but the alcohol can just
Remember,
throw
guys, we've got to be
on a
careful to
flame,
not fall into stereotypes.
Is there research that looks at how women cope with the violence and abuse in their relationships?
Yes, there is.
Please tell me about it. What does it say?
So there's been a lot of research to talk about what do women do. That's the question that everyone wants to know. Why doesn't she just leave? And in asking that question, why doesn't she just leave, we actually are able to say, well, let me tell you what she does do. And what the research shows is women do a lot of things in that relationship. So there's sort of three main categories. One of the formal responses, the formal things that she does. Call the police, participate in prosecution of your partner, go see a therapist, go to a shelter, go to a hospital.
Like what Johnny did?
Formal strategies that women can use. Then there are the informal strategies, and that's talking with your best friend, talking with your mom, talking with your friends,
Johnny
trying
did?
to get that emotional support from your social network. But the most common one is these personal strategies. And the personal strategies are really talking with your partner. They're trying to fix the relationship from within the confines of the relationship. You know, trying to get him to go to counseling, try to get him to go to church, try to get him to understand his ways, try to get him to get into AA or sober counseling or harm reduction model to help with his addiction. compliance with his demands, anticipating his demands, all these coping strategies that are sort of, embedded within that intimate relationship.
Oh my God.
Let's talk about the calling the police. Is that a common response?
It's not a common response. Many women do not want to call the police on their partners. Using criminal justice interventions in crimes.
Well, Amber called the police.
Women and children are the least likely
Except they
to
didn't
be
find
called
anything.
into law enforcement. And
Isn't
most
that
of the time
interesting?
when the police are called, it's because a particular incident has got out of hand and she feels unsafe. And the only
But Johnny
way
wasn't
that
even there.
she feels I can get this
Think about
incident
that.
to end and stop is by calling law enforcement.
And if police are called, does the woman typically participate in the prosecution?
I mean, this has been a problem and a difficulty for
Oh my
prosecutors
God.
across the country since I've been doing this work. I'm actually frequently called by the prosecutor to testify about a fact pattern because the victim won't come in and testify. So dropping restraining orders, not participating in the prosecution is a very common dynamic in situations of intimate partner violence, domestic violence. And what we know and what we know from our law enforcement data and colleagues is that when you get that 911 call, they're very specifically trained to say, that's likely not the first episode. The chances are there have been more severe episodes before you get this call. So you can't go on the scene and think that this is the first episode of violence. And that's why a thorough assessment is supposed to be done when police officers arrive on the scene.
What happens when it results in nothing
usually
being
that
found?
episode that calls the police is just meant to stop that incident in that moment to get a sense of safety. But most women don't want to participate and
Oh
go
my
forward
God.
with restraining orders.
Why do women in violent relationships stay in the relationship when the man's hurting them?
I mean, they stay for all the reasons we talked about in the cycle of violence. They
And
stay
now
for
the
loving
lawyer
man.
is
They
using
stay
the
for man
language
who's
too.
kind. They stay for the man they
it's
decided to
one thing-
marry and had hope and promises for their future.
Oh my
So
God.
there's a lot of sort of love and attachment is why they're connected to their partner. Some people stay because they have economic reasons and they don't have tangible resources
Yeah,
to leave.
sure.
Some people have children in common and they don't want to deprive their children of a father. So some people fear retaliation. If I leave, I'm going to
I
get
can't wait for him to go on
seriously
break.
hurt.
I'm going to
And
go on a rant.
frankly,
Oh
the
my
statistics
God.
bear it out. The
Oh
most
my
dangerous
God.
time for a woman is when she's leaving that relationship. Her likelihood of being killed
I'm about
goes
to go wild.
substantially at that moment. So leaving sometimes isn't a best strategy. Staying keeps her safe. So there's usually a multitude of factors of why a woman decides to stay in the relationship. And again, as I said previously, it doesn't mean she's unconcerned about the violence. It's just she hasn't figured out a way out yet.
What, if any, role does emotional attachment and love play in that?
That's probably the biggest one is that you have this, we talked about that trauma bond that has developed,
Oh
that
my God.
psychological attachment to your partner. You don't want to leave him. You've connected with him on so many other levels that giving that up just feels like a threat to your integrity. You're just sort of, and a threat to his, because you're just so intertwined and attached.
What, if any, role does hope and optimism play?
Oh my God.
Hope and optimism are really what keeps victims alive in these situations. That's what gets them going from one episode to the next.
What
To
a
get
bunch
up
of
the next
horse
day,
shit.
Maybe he's not going to drink today. Maybe it's going to be on his good side. Maybe he's going to come home and not disappear for 3 days. Continuing to hope that some type of change is coming down the pike.
Now, you mentioned lethality a little earlier. Can you please explain to us what that means?
So lethality is means death, means fatality.
Yeah, what's the chances of getting
and
hurt are?
we
Yeah.
have very
Obviously.
well validated instruments and data that looks at what factors happen in a relationship where a woman ends up dead. And we do that through looking retrospectively, saying, here's, this person ended up dead, killed by her partner in a homicide, and let's see what factors were there so that we can work at preventing it. It's very methodologically sound over
Oh my
different case
God.
controlled designs over multiple cities, used by the FBI and law enforcement. So these are a number of factors that tell us that somebody is in a very dangerous situation. So some of the factors are, an increase of frequency and severity of the violence, threats to kill, choking behavior, sexual assault, obsessive and possessive jealousy, controlling behavior, the perpetrator's use and abuse of substances, alcohol and substances, the perpetrator's threatening of suicide himself, right? Those are some of the top factors, and there are more that are very, very dangerous. When we hear that and we hear a woman is in a situation where those are present, then we are moving out of situational couple violence.
What, if any, role does destroying property?
And destroying property, destruction of property, personal property is also one of the risk factors for danger and fatality.
And what, if any, role does leaving threatening messages play?
Yep. That's also a risk factor for lethality.
What are the psychological and traumatic effects that such interpersonal violence has on victims?
Objection compound.
Psychological and traumatic effects are kind of interchangeable.
I'll sustain the objection.
What are the psychological effects that such interpersonal violence has on victims?
So these have also been well researched, and they are wide and varied. We see depression and depressive disorders, sometimes with suicidality.
Oh my
God. We see anxiety and anxiety disorders, a lot of stress.
Oh my
we see
God.
Post-traumatic stress disorder. We see substance abuse and substance abuse disorders. We see trust difficulties and difficulties in interpersonal relationships. As a result, we see a lot of shame and humiliation. We see anger and rage, a whole sleep disruption, a whole host of difficult psychological consequences having sustained a relationship of intimate partner violence.
What, if any, role does low self-esteem play?
Well, low self-esteem is a very common after effect, and that, you know, when you're embedded in the relationship,
yeah, she's describing Johnny. No, I know.
To climb your way out.
What is emotional dysregulation?
Emotional dysregulation, so the DYS, dysregulation, is when you sort of don't feel that you have control of your emotions. You feel like you're fluctuating, you know, from one to the one to the next. It's not the same as a bipolar disorder. It, you know, can happen in short moments that, you know, it's really because your central nervous system is so out of haywire from being exposed to so many traumatic events that you may feel things deeply and with a short trigger in a very quick time.
In your experience, is there a particular
more
way
rationalizing
victims of intimate partner
that's
violence
more
remember
rationalizing
the violence they endured?
Well, memory for traumatic events is something that has been well researched. Sometimes people have what we call dissociative amnesia, where because of the physical or psychic pain of what they're going through, a portion of the memory either gets blocked or can't get retrieved, whether it's stored or retrieval, we're not really sure. But most of the times, the memory is really about when you have multiple repeated events of the same type of thing. So if you are abused multiple times and the abuse is very similar, it's very common for the victim to lose discrete details of a particular incident. They may not retain the memory for the complete
people
incident.
Forget
and that
shit.
Might not be to dissociative amnesia. That just might mean to forgetting because you have so
Johnny,
many traumatic events that have happened to you.
Are there common myths or misperceptions about domestic violence?
There are. I hope I've dispelled some of them here already, but I mean the myths, you know, certainly are that women are meek, are passive, are, you know, just sitting there and letting the abuse happen, that women don't fight back, that women don't yell back, that some old ones, that they like the violence, they're not concerned about the violence, that if it was really bad, she really would have left. If it was really bad, she really would have told the police.
What about that it's not always she?
That just don't comport with the research.
Are there also myths about trauma survivors, how trauma survivors present?
Yes, there are, and what we say is, you know, how lay people think someone who suffered a traumatic event is supposed to act. So in the immediate aftermath of a trauma, people think, oh, they should be hysterical and abreacting and emotional all over the place. And that's typically not the first reaction of a trauma survivor. The first reaction is, you know, suppression, emotional numbing, emotional constriction. How do I get through this? You know, women who are beaten, they get up the next morning, they get their kids dressed, They get them to school.
Oh my
they go
God.
to work. They do a presentation in their office. They go on with life. The
Oh
most
my
normal
God.
thing that a person does who's experienced trauma
Oh my
is to
God.
get up and try to be normal. They're striving for that all the time. So sometimes
just-
if you see somebody
bro.
who is more emotionally constricted, looks maybe stoic, looks like they're not feeling, it doesn't mean that they're not having internal reactions. We say this in the field of clinical psychology all the time. The inside doesn't match the outside. What you're seeing on the outside may not match what's going on for the person inside, because they have to be so controlled, because the fear is that if I let out a little of this emotion, I'm not going to be able to put the floodgates back on. It's just going to be too overwhelming. And that's true for people who are involved in litigation, and also true for my private patients who are, even though they're
I'm about to
coming
write
me
out a
for
list
help,
of all
they
the
try
things I have to say.
very, very cleverly to
Oh
not
my
want to
God.
feel the difficult emotions
Oh
of
my
the trauma
God.
that they experience.
Oh my God, I'm gonna write out a list.
Is it
What?
also possible that they can look very friendly and smile and laugh and things like that?
Yeah,
I'm
absolutely.
gonna write out a list.
Sustain.
What, if any, please describe some of the ways that a victim can hide that, as you just testified to.
We call that the appearance of normalcy, the appearance of competency, right? And it doesn't mean that they're not. It doesn't mean that they're not normal and that they're not competent, but it doesn't give you a bird's eye into their inner experience. And that's what we do we say in the rooms of therapy, where we really help people deal with that they keep to themselves. But yes, someone can be smiling and happy. It doesn't mean that they're not suffering inside.
Is there a single profile that fits all women in domestic violence situations?
What the fuck?
No.
Is there a single profile of a man who perpetrates intimate partner violence?
No.
Your Honor, I'm at a point of moving to a new topic area. I don't know what Your Honor wants to do, because I know we switched the lunch route. I'm perfectly happy to keep going, but if this was a good stopping point, we could make that for the
Oh
break.
my God.
All right, let's go ahead and take our afternoon break for 15 minutes, okay? Just do not discuss the case and do not do any outside research, okay?
Okay.
It's a little early.
All right. All right. Thank God. Thank God. All right. I'm about to go in on this. Let me let them finish, and then I'm about to go in on this. This is wild. I got 15 minutes. I got 15 minutes to mull.
All right, and Dr. Hughes, since you are testifying, please do not discuss your testimony, including the attorneys at this point, okay?
Yes.
All right, we'll come back at 3:15 then, okay?
Thank you, Your Honor.
Okay. All right. I don't even know where to begin. I'm gonna begin at the very start. How the fuck do you bring somebody on to discuss whether domestic violence occurred either way and have them use language that is in one direction, and then have the audacity to sit there and say that it can go both ways and it's a misconception that only men perpetrate it, and then you go right back to saying her victimhood, his abuse? What a bunch of fucking bullshit. If you went, like, imagine you haven't seen anything about this trial, period, and the only thing that you saw was this. The first thing that you would think is that Johnny was guilty. 100%. Because, and here's what the difference is because this person was brought on as an authority on the subject. Like, for example, when they bring on Johnny's friend, it's obvious that this person is going to be Johnny's friend and they're going to have Johnny's side of things because they're a witness that's friends and has a relationship with Johnny. But she was brought on as an expert fucking witness in the category, or in like whatever you want to call it, in the field in general. And the fact that you're taking that, and it's very different than just somebody bringing their friend on that's involved and they're friends with one of the people in the case. Because this is a person who is supposed to be an objective information giver for these kinds of things. You see what I'm saying? They are supposed to be non-biased. And I can't fucking believe this. They're doing the same thing Johnny Team did with the Curry expert. Not necessarily, because she never said the Curry that's the hot lady, right? She never implied, and also, like, I'm pretty sure she worked with Johnny. No, that's completely not true, because she worked with Johnny. So there's already an established expectation that she had a relationship with him in the first place. So she's being brought in as a person who, like, yes, obviously they are a, you know, they're an expert, but their relationship is already established. Yeah, she worked with Amber. She's a defense witness. Yeah, and that's what I'm saying. I'm so... Men Too is trending on Twitter. It should be. It's just nuts, man. Imagine other less famous men this woman is testifying against. They have no chance against this bullshit. Here's what's so fucking disgusting about this. Is that this woman testified, she even said 50 times. 50 fucking people probably have had their lives altered in some way or another, or at least had it closer to being altered because of her bullshit fucking language. It's just, it's such horseshit. And, like, yes, of course, according to the data, that's what happens. According to the data, there's a lot of things that happen. But that doesn't mean you treat each individual case as if it's a statistic, because it's dehumanizing. Like, it's just, this never happened in Sweden. I don't know what would happen in Sweden. I have no idea. Do you think the judge will see through this? I think that everybody sees through this. And that's why I'm so glad that it's happening. That's why I'm so fucking glad that we get to see this in plain sight in front of everybody. And you can see how absolutely fucking biased it is. It is completely fucking biased. It is completely unfair. And the fact that nobody's standing up to say, hey, listen, maybe if you're using gendered language to describe a situation, this isn't very objective, is it? But no. It's just, I'm so fucking annoyed by this. The jury have to see through it? Yeah. And it's just, the judge apparently doesn't know anything about how relationships work, so our questions about every angle. I don't know about that. I think that's too much. But you only saw an last couple witnesses. You think Depp is 100% innocent. That's why they bring, party brings both people. Did the person that was just on state that she had any relationship with Amber? Because I don't remember hearing any of that she didn't have any real relationship with Amber. No. So that's the difference. That is what the difference is. Never asked. Yeah, exactly. So the other people had an established relationship with Johnny Depp. They had an established relationship with him that contextualized their testimony. She did not. That's the difference. And so you bring somebody on as an unbiased source while they're using gendered language. That's bullshit. It's absolute fucking bullshit. We don't know yet? Oh, so let me get this straight. So if they ask it at the end if she's worked with Amber, is that no? That's also, it's dishonest, because people at that point will have already made up their mind about what they think before that information is made available. People's first impression has already been made. That's why every single time they ask it at the beginning. If you're asking at the end, there's a reason for that. Here's one thing I've always said, is that if anything ever fucking deviates from the norm, it's because they're doing something under the table. I use the pronoun she for victim and he for abuser. It's total bullshit. It is. It's absolute fucking total bullshit. Doctor testimony is more damaging than it is helpful for the defense. It exposes the bias. I don't know. I hope so. I really hope so. But, like, this is what's so scary to think, right? Is think about all the people. Like, as I said, my friend Jeff had this happen, right? Jeff gets fucking abused. His ex-wife is hitting him downtown. Cops show up. Guess who ends up in the car? Jeff's in the car. Jeff's in the car. And like, it's so fucking ridiculous, man. It really is. She spelled someone generically. Dr. Kerr was more specific. Exactly. And that's why they had her speak generically. They had her do that. And also, by the way, she has, like, how many other interest groups did she have that was for women? Like, how is this not a fucking bias? that she's using gendered language and she's like part of 3 or 4 other groups that are for women specifically. It's a disgrace. It's an absolute fucking disgrace, man. It's disgusting. Surely it's so transparent, though. I know. And your feelings, your personal anecdote doesn't apply to every situation. Yes, and neither does statistics. And that's why using gendered language whenever you're explaining the dynamics between a victim and abuser is harmful. I agree with you. Like, that's exactly my point. That's my whole fucking point, man. I'm just, especially when, and then also the leading questions from the lawyer, right? Trying to, like, you know, muddy the waters between, oh, well, she's yelling, he's hitting her, she's hitting him. You know, it's a he said, she said situation. Who knows who's wrong? What a bunch of fucking bullshit, man. That's why she's so qualified. She's shocked that she was slanted with her language. I'm not. Because why do you think so many guys have this problem with like not getting a fair shake? Well, it's because people like this that are so qualified are in there making decisions in positions of power with an obvious fucking bias. I'm so annoyed by this, man. I really am. How about the part where everything that Amber did was Johnny's fault? Yeah, that's the implication. It's the most leading testimony I've ever seen. The whole thing should be stricken. It should be. But it won't matter if it's stricken because the jury's already heard it. They've already made part of their decision. They've already, they've already worked that out, like, entirely. She works primarily with women. Don't be surprised her language skews in that direction. It's acknowledged it happens both ways, too. That looks bad, but the language is common parlance. No, it's not. No, it's not. She works commonly with women. Like, so how is this, like, also... It's a clear fucking bias, man. Yeah, it's an obvious, clear fucking bias. She does media for all mainstream media and court TV, which shows her bias is supported by lobbyists and ACLU Democratic Party. She'd have more credibility in this. You show court. Listen, I don't want to get into Democratic Party. This is not politics. This is fucking, like, this affects everybody. It's just, it's a fucking disgrace, man. It really is. Never managed to record every part of her marriage except the parts where Johnny Depp allegedly abused her. Yeah, that's because it didn't happen. Like, that's exactly what happened. And it's the same as, like, whenever she was talking about, oh, well, like, it's like whenever the cops show up, they have to make sure it's not the first case of the abuse. And it's like, well, what happens whenever the cops show up and the abuser isn't even there and there's no signs of violence that's documented in the police report? What about that? God. I really do hope everybody sees this, man. I really, really do. Like, this, I'm actually, like, it's, oh my God. Thank God. Thank God. I'm reading some of these comments here. Well, read these. It's on, we're gonna look on the Twitter. And these are women saying this too, which is the best part. We have to be careful of gender stereotypes. She's a woman who only said she for all victim points. The lady is really getting to me. Men don't stand up because of the right here. I stand with the men that are trying to have a voice too. Exactly. This is getting on my nerves, gender specifics and abuse. I see Amanda found a psychologist who thinks that male abuse victims don't exist. Well, they clearly exist, and she even admitted that. But based on her language, you'd think that they didn't. In Dr. Dawn Hughes' view, well, it's not in her view, it's in her language. He is an abuser, she is a victim. There are a lot of men suffering from domestic violence, but they keep silent. Hopefully Johnny Depp trial will give men courage to stand up. It's just... oh my God. What a bunch of fucking bullshit, man. A lot of women who are more furious than men at the moment? Exactly. Because this case does more to discredit women's future allegations of assault and abuse than anything else. Because what you're seeing here is you're seeing a person with immense power and privilege, with Amber Heard, and deliberately sabotaging Johnny Depp's career in a tangible way, and the audacity that they have to try to compartmentalize her damaging his career into one article as if, oh, it's not damaging to his career? Well, then why the fuck did he lose his roles then? It's just such horse shit, man. Like, I can't believe this. 98% of women are telling you the truth, but women who lie fuck it up for everyone else. Most of the time, that's the case with most of things, right? And now, you know what I said. This is what I've said before, and this is why probably these women are pissed off too, is that now what's going to happen every single time that there's a case of a woman who gets abused is people are going to ask the question, is this real, or is it like another one of the Amber Heard, Johnny Depp things? And it's going to shed a shadow of doubt on all of this. Melvy's clarified that it happens in same-sex relationships. Yeah, so what do you think? Do you think that it matters that she clarified that in 5 seconds, or she gave a 20-minute testimonial that implies the opposite? What do you think? Like, yes, you're right. It's like a disclaimer, right? It's like a disclaimer before they start promoting gambling or something like that. It's so annoying for me to see, man. It really is. Like, I'm fucking pissed. Let me read this. Psychologist witness stand for Amber Heard is so biased. Only women being abused that she couldn't see men as victims literally happen in front of her. I'm a woman and a survivor. I know a lot of men who are victims and survivors. I'm utterly disgusted by Dr. Hughes' dangerous and biased view. She has no place in mental health. Obviously, she'd have her license revoked or forced to take further education. Well, I think that it's very telling the fact that she holds so many positions of power and she's testified so many times before. Because you know she said the same thing and those other 49 cases didn't have the same level of scrutiny on them, and she could have fucked somebody else's life up and we don't even know about it. You see what I'm saying? Scroll down. I'm reading some of these. All I'm hearing is she. Like, can someone tell this one meant to? Yeah, this is nuts. Jesus, man. The whole Johnny Depp situation is separating real victims, advocates from the fake. Yeah, true. Our justice system is unfairly geared towards women on such issues. Men's abuse is erased and even ridiculed. Believe and help survivors, and even male ones. I'm not going to say necessarily the entire justice system is rigged against men in this regard, but I will say in this case, there's certainly a fucking bias. There is absolutely, certainly a fucking bias. Do you think she holds these positions without being a feminist? I don't care about labels. I like call a feminist, mainstream media, Democrat. Like, these don't mean anything. These are just these are artificial ideas that you put on somebody to put them into a category. Like, I don't want to hear that. She works mostly with women. Most material she discusses with women. You have a hard time finding anyone in her field. Doesn't deal primarily with abused women. Let's see if Johnny's team points out her language. I have no problem admitting that women probably, like, if you look at homicides, how many men kill their girlfriends and how many girlfriends kill their boyfriends. I think that there's probably way more men that kill their girlfriends. And in terms of like actual like abuse that sends you to the hospital, probably way more men do that. I think we can all agree on that. Everybody fucking knows that. But it's one thing to acknowledge that, and it's another thing to use language as if you are setting that as the precedent. And this is what the problem is you're taking something that is a fucking stereotype, and this is what I said the other day with men and women, and like people make all of these different fucking stereotypes, right? Is that you can never take a stereotype and apply it to an individual and have it not be dehumanizing. You can't take a statistic and say you're part of the statistic, and so I'm going to categorically assume your guilt or your innocence. It's disgusting. It's absolutely fucking disgusting, man. Look at her reviews. People are just going to give her bad reviews because of this. It doesn't mean anything. It's so easy to say person instead of she or her. Exactly. It's like, oh, she can't do that. No, I don't think. I think that she's doing it on purpose. I do. Why? People are canceled and turned into DM and media because of allegations. Shouldn't wait till it's proven in court. Depends on the allegations. Yeah, I don't know. It depends on the evidence and the allegations. Treat individual cases by statistics and stop looking for murders and just lock up the partners in every murder case that happens. Yeah, it's just nuts. I'm...
All right. Are we ready for the jury?
Yes, sir.
Okay.
Okay, all right. Please, please call this shit out. Please call this shit out. Let's go. I'm ready. They need to say something, man. Like, somebody needs to say something, like, check Twitter. Like, she'll be actually shook right now. No, she probably didn't do nothing like that. Probably just sitting there. But, like, I just... People need to understand this language shit, man. Nobody ever gets it. And it just goes under the radar, and it's so fucking insidious. It's so effective, and people can't even see it. It's so annoying. It makes me fucking annoyed, man. So mad. Like, please. I'm not gonna stand up. Stop. Oh my god.
All right. Be seated. All right. Your next question.
Thank you, Your Honor. Dr. Hughes, did there come a time when you conducted a forensic psychological evaluation of Amber Heard? And please tell the jury what a forensic psychological evaluation is.
Could you turn it on at the bottom base?
Okay. A forensic psychological evaluation is an evaluation that is conducted for the courts to answer a particular legal question. It contains multiple parts. Ms. Heard is not a client of mine. She's never been in therapy with me. She's not under my clinical care. It is an objective evaluation to determine a particular legal question. Forensic evaluation follows a methodology what we say it's a multi-method, multi-hypothesis-driven methodology, which means I look at a variety of different documents and data using multiple hypotheses. It's not just one hypothesis, one theory of the case. You're going in looking to see, what possibly could be going on here. And then you use the data to arrive at that opinion. You look for consistency across the data to arrive at that opinion. And the forensic psychological evaluation has many parts. It has the clinical interview part, a structured or semi-structured clinical interview where I'm asking Ms. Heard lots of things about her life, both before Mr. Depp and after. It involves a psychological testing component of the evaluation, which allows me to do a good broad scan of different symptomatologies that people might have in their lives, as well as to have indicators of how she approached the test. Is she defensive? Is she malingering? Is she feigning? Is she exaggerating?
Yes.
It gives me indications about how she approached the evaluation. I review a number of documents, medical records, psychological records, the text, the audio, all the different things that we've had in this case, and then I conduct collateral interviews.
So, Dr. Hughes, just to be clear, do you assume everything the victim reports is true when you conduct these examinations?
No, of course not. I always approach a forensic evaluation with a healthy dose of skepticism. With any forensic evaluation, there exists a motivation that the individual may be telling you something that is not accurate. It doesn't mean that that's there, but you have to control for that and know that you're looking for, again, what does the data tell you, the external data, about what the person is also telling you.
Did the forensic evaluation follow a standard methodology, or was it specific to Ms. Heard?
No, this is my standard methodology that I would use with any individual who's in a forensic matter, and I would just call to evaluate them.
When did you meet with Amber Heard?
Okay, so I met with Ms. Heard for a total of about 29 hours. I met with her for the first time in September 2019. I saw her for 4 visits in live in my New York City office. That's about 21, 22 hours. And then I saw her twice over Zoom. One was in January 2021. And
but I thought she said, not a client. Like, yeah, come on, go up there, please. Please go up there. Like, what a bunch of fucking horse shit, man. Are you kidding me? There's a difference? No, there's not a difference in the eyes of the public, okay? And that's what they're fucking... I know that there's a difference. Oh, I met with her and she's not a client. Yes, there's a technical difference. But they are using that technical difference to portray an objective perspective. It is obvious what's happening. It is obvious. Don't fucking go and use like your legal technicalities whenever you're talking to people that don't know anything about the law. It's deliberately misleading. Why was that not said at the very beginning? That she had met with Amber Heard.
In answering that question, were you consulting anything?
Dr. Hughes.
I wonder why.
I'm so sorry. Dr. Hughes, were you consulting anything? Dr. Curry's here, I guess, as well. That's what confused myself.
I'm consulting my cheat sheet of the dates that I saw Ms. Heard so that I could accurately report to the court. I also have my final designation in front of me so that I could give the most accurate information to what I put in that report.
Okay.
Yeah.
Okay. And do you want to see that? Okay. Should we just take the break now and have him look at it, or does he want to?
Would you like to look at it now or before cross-examination?
It's just to post it.
Okay, before cross-examination.
Okay,
All right,
that's
that's
fine.
fine. Thank you.
Okay. Please continue. I think you were telling us when you saw Ms. Heard.
Sure. So there are 4 dates in
Okay, here we
person
go.
in New York City
Here we go.
for a total of about 21 and a half hours.
Not a
And then I
client,
saw
by the way.
her in January 18th, 2021 over Zoom for 3 hours, and then December 27th,
Not a client.
2021 for 4 hours over Zoom.
Not a client.
And what did the evaluation consist of?
So as I stated, the evaluation consisted of psychological testing, a semi-structured clinical interview with Ms. Heard, a review of
Not a
a
client.
whole host of documents relative to this case and medical records and
client.
psychological records,
Not a client.
and then 3 collateral interviews,
No.
2 with her treating
Not
therapist, Dr. Bonnie Jacobs, Dr. Connell Cohen, and also with her mom.
And in the semi-structured clinical interview, what were you assessing?
Well, when someone comes in for the evaluation, you sometimes don't know what you're going to see or what you're going to get. So you absolutely have to do a full clinical interview and have a sense of their life patterns, things that have affected them in their lives, you know, where they have worked, where they have lived, just get a full sense of their sort of being before the incident for which they're talking about. Then I do a full intimate partner violence assessment, looking at all those characteristics that I talked to you about earlier to get a sense of the full structure of and the dynamic of this relationship. I also did looking at what were the effects, what were the psychological consequences of being in that relationship.
And what'd you
And I
find?
also looked at the psychological consequences of some of the statements that were made by Mr. Depp through his attorney
She's not a
that are
client.
part of this, the counterclaim in this lawsuit.
At the end of that process, considering all the data, did you arrive at any expert opinions?
Yes, I did.
Okay.
All right. I'd
Thank
like
God.
to start with your
All right.
main expert opinions.
Here we go.
And then go through those.
Now we have the
Can you
actual-
please tell the jury what your main opinions were?
So like I said, there are opinions embedded within
Okay,
them, but
finally.
the main opinion is that Ms. Heard's report of intimate partner violence and the records that I reviewed is consistent with what we know in the field about intimate partner violence, characterized by physical violence, psychological aggression, sexual violence.
She said
coercive
something that happened to
control,
other people?
and surveillance behaviors.
Wait, well,
What
what?
was the other main opinion that you had?
The second main opinion was that that Ms. Heard demonstrated very clear psychological and traumatic effects or the exacerbation of trauma from those statements that Mr. Depp made through his attorney. There were 3 statements that we evaluated to see how they affected her emotionally and psychologically, and it was my determination that they did.
Of course
And
they
did you arrive at any diagnostic conclusions?
Yes, I did.
And what were those?
I diagnosed Ms. Heard with post-traumatic stress disorder.
And what, if any, etiology was associated with the post-traumatic stress disorder?
So the etiology is the cause. In order to have to
Not a
meet
client.
criteria for post-traumatic stress disorder, you have to have an actual cause. It's one of the few diagnostic entities that we have to have a cause for, and the cause was the intimate partner violence by Mr. Depp. That was what was pushing the symptoms. That was what was related
How
to
would
the
she know
intrusive
that?
phenomena. That was related to her avoidance. That was related to her differences in her mood. That was related to her avoidance efforts. So it was the cause was the intimate partner violence by Mr. Depp.
Now, let's first go back to the forensic evaluation. You mentioned you reviewed documents. What documents did you review?
Diagnosed, but not a client.
So I'm going to refer
20 plus
to my
hours,
list of
but not a client.
documents
I'm just...
so that I can be clear for you all. It is a 4-page.
All right. If you want to approach.
Oh my God. Like, I see this shit. And it's like, so she said that they were consistent with what they have heard before. Like, I just, like, it was consistent. Like, I hate that language, because the saying that it was consistent with what Amber's testimony was consistent with what they had heard before implies that she was telling the truth and that it's happened. Like, you see what I'm saying? Like, you see the mind game that you're doing there? Oh my God. Like, and like the fact that, like, how long are we into this fucking testimonial until we actually found out that she had a relationship with Amber Heard? Like, shouldn't people have known that immediately? How the fuck is this happening? Like, why is it that every other person, their relationship with the person that's in the case is immediately, at the very beginning, disclosed entirely? And they didn't even ask her. They asked her if she was a client, but they didn't even ask her if she had received any monetary compensation. You notice that? There was not even a question about that. There was just if she was a client. So that way they could get off on a categorical technicality without saying that she got paid. What a bunch of horse shit, man. Like, I can't, I swear to fucking God. Like, oh my God, I'm so mad. I'm so fucking mad that this is happening. Experts are always paid. Yes, why is this happening? Like, Johnny's lawyer will ask that? I'd be fucking better. Yeah, he'd fucking better ask. She's literally a professional paid witness. No, it's no problem to bring people that were paid at some point. Yeah, I hope he's saying this is some motherfucking bullshit. Like, she's, and like, also, remember, this woman here, the way, she encouraged the gendered language. Because you saw before the break that she asked questions baiting the she's and things like that as well. It wasn't enough that the doctor was using it. The lawyer was baiting that as well.
Dr. Curry, if you, I mean, Dr. Hughes, I don't know why I keep doing that. My apologies. My apologies. Dr. Hughes, I think it's the confusion of having her in the courtroom. Dr. Hughes, if you need to consult your notes to answer something, let us know
Dr.
that
Carey's
you
the muffin
need
lady.
to consult your notes. Otherwise, try to answer to the best of your ability. And then if you need to do that, just let us know you're consulting your notes, okay? The concern is that you not read from them, that you consult them as you need to, okay?
Correct. I just don't want this to be a memory test of having conducted
I don't see the problem with her reading
documents,
the notes.
80 pages of notes,
But
and 12 psychological testings to...
You can reference your notes, just don't read from them, okay?
Yeah, no problem.
Okay.
Okay, great.
Yeah, I don't
So
see a
please
problem.
tell us what documents you reviewed. Please tell the jury.
It's a script.
Okay, so I reviewed a number of documents, a plethora
I
of
don't know.
documents, most, and I obviously won't read them all,
50 times
but
in
I
court, by the way.
reviewed
Yep.
certainly all of Ms. Heard's testimony that she gave, in her deposition testimony in
The accounting
this
guy
case,
didn't
her
need this.
deposition or her trial testimony in
He
the
knew what
UK
time the meetings
case.
were.
I did the same thing for Mr. Depp.
Remember
I
that?
reviewed his deposition testimony as well as his trial testimony in the UK as well. I reviewed a number of the
Not
depositions
a
that were
client.
put forth in this case. I reviewed
Not
the
a
psychological treatment notes for Dr. Bonnie Jacobs, Dr. Connell Cohen, Dr. Laurel Anderson, and Dr. Amy Banks, although she did not have treatment records. So I reviewed not only their records, did collateral interviews with some of them, and also read their deposition testimony, and also read other medical records in this case, nursing notes in this case, in the highlights. And I also listened to the audios that were put forth in this case and read the text messages and emails.
Not a client.
What, if anything, did you do with respect to any videos?
No question
And I also
about monetary
saw
compensation.
the video in the kitchen. Yes.
Okay. Now, the collateral interviews that you conducted, why did you conduct those?
Well, collateral interviews is a standard part of a forensic evaluation. It's an opportunity to hear from another treating clinician, the person who's actually treating the individual you're evaluating, and get a better sense from that person of what they saw, what they knew, how they experienced this person. Sometimes our clinical notes don't give the full breadth of what really was going on in that therapy, because the notes are meant to be sort of short and to the point of what happened, who was there, and what was the plan. So it was really helpful to talk to these two clinicians who really were with Ms. Heard throughout the duration of her relationship with Mr. Depp. So they give us sort of a contemporaneous look at what was going on for her emotionally, and then what was she reporting, what was she saying about the relationship.
What was she reporting?
And
What were the
you
police
mentioned
reporting?
The name Dr. Bonnie Jacobs.
Oh, that's right.
Please
It
tell
didn't
the
happen.
Jury who Dr. Bonnie Jacobs is.
So Dr. Bonnie Jacobs was Ms. Heard's therapist, and may I refresh my recollection with my notes, Your Honor?
She's allowed to
For the
consult the
dates,
notes.
if you'd like me to tell the dates.
She's sweating.
If she's asking me a question,
Yeah,
I'm not
yeah,
Look
yeah,
at her
you're
face
right, you're
whenever
right.
she looks towards
Yes.
the
May
light.
I?
Yes, you may consult your notes, yes.
Objection.
Look at
Your
her
Honor.
face. Objection.
Can we be heard?
Please, please, bro. Like, please. Please, bro. Like she's going off script 50 times. Yeah, objection. There it is. Yeah, let's go. Let's go. Don't, thank you, John. Don't even, like, yeah, exactly, bro. Like, that's some fucking, like, isn't that some bullshit, man? What a joke. She shook her head being mad. Yeah, of course she's fucking mad. She's pulling binders out. I have no problem with her reading what she said, because, like, she probably just, I don't know, like, people nervous in court, they don't know how to say it right. I don't know, I think that's fine. But, like, it's just, oh my god, man. Just call a community uproar for some comments. No, they don't check their phones during this. Like, they're not supposed to, at least. I don't know, maybe she did. I doubt that's what happened. Funny how she can't remember how her job works now that she can't read her script. This trial was pay to win. She was definitely store-bought. Honestly, I don't think that you need it to be pay to win. I think that she's just, like, I actually don't think that she's paid. I don't think she got paid. Well, actually, like, I don't know. Like, I'm not sure.
Go ahead.
Oh, thank you.
I'm just fucking...
So she treated with Dr. Bonnie Jacobs, who is a psychologist, from October 2011 through August 2014. She actually was seeing Dr. Jacobs somewhat earlier, before she got in the relationship with Mr. Depp. And then she transferred care to Dr. Connell Cohen, who was referred by Dr. Kipper, who was the treating physician for Mr. Depp, and then later for Ms. Heard. And she treated with Dr. Cohen from after she left Dr. Bonnie Jacobs in September 2014 to June 7th, 2016.
Okay, thank you. And so you, and
Okay.
I guess you got ahead of me there, so you also talked to Dr. Connell Cohen, correct?
That's correct.
Okay. And you also spoke with Paige Heard, did you say?
That's correct.
And who is Paige Heard?
Paige Heard is Amber Heard's mother.
Okay. And when did you speak with Paige Heard?
I spoke with all of these individuals at the end of 2019. Again, I can check my notes and let you know the exact date if you'd like.
I think the end of 19.
Yeah, they all were in
is
the
fine.
end of 19, yes.
All right. And you are you aware that Paige Heard has since died? She died 2 years ago?
Yes, I am aware, sadly.
Okay.
Well, that sucks.
Now, let's talk about the psychological testing. You stated that you conducted psychological testing, is that correct?
That is correct.
Can you
Overruled all out.
Can you please tell the jury how many psychological assessments you administered to Amber Heard?
I administered 12.
Relevance?
Can you please tell the jury which
Yeah,
ones
true,
you
actually.
administered?
So I am going to refer to my designation that has the list so that I don't forget anything.
Yeah, that's actually a good question. Why would you even ask that? Yeah, are you aware, like, bringing up that she died, like, that's actually, like...
So I administered...
why would you
Objection, hearsay, Your Honor.
She can refresh her recollection.
As long as she's not reading it.
Right, you just can't read.
Like-
You're not supposed to read from it, but
Yeah,
you can refresh your recollection as you're speaking.
So I can look and just look up, and that's refreshing my recollection? Okay.
All right, if we could approach for a moment.
Shut up, Dr. Carey. Shut up. Nobody wants to hear you anymore. She's getting sassy? Yeah. She's so invested in this? I know. Oh, man. She's getting mad. I feel like she's trying to have, like, all these, like, specific dates. Like, it doesn't really matter what the specific dates are. Oh, my God, man. Like, what a professional Karen. Yeah, she's getting fucking mad and shit now. Like, oh, my God. It's just... It's so frustrating to see this, man. It really is. It is so fucking frustrating to see this. My first impression was on point. Yeah. She argues at restaurants, you can tell. She has her own credibility riding on this. Good. Yeah, there's actually Dr. Curry there on the right. She's the one that testified a few days ago. Remember that. Professional arguer? Well, she should have gotten fired if that was the case.
That you administered, please.
Yes, I can. I administered the Personality Assessment Inventory, which is a broadband instrument to scan for psychopathology and psychological symptoms that people have. I administered the Trauma Symptom Inventory, too, which is an instrument to scan for common traumatic effects that people have. I administered the Miller Forensic Assessment of Symptoms Test, which is a measure of malingering. I administered the Post-Traumatic Stress Disorder Checklist for the 5th edition for the DSM-5. I administered the Clinician-Administered PTSD Scale for DSM-5. I administered the Beck Depression Inventory, the Beck Anxiety Inventory, the Mood Disorders Questionnaire, the Danger, I did 3 intimate partner violence measures, the Conflict Tactic Scale, the Abusive Behavior Observation Checklist, and the Danger Assessment Scale. And then I also did the Life Events Checklist, which scans and gets us to ask about a lot of traumatic events that an individual may have experienced, and we administer that typically before either doing the PCL or doing the CAPS.
Thank you.
I want the judge to get her name wrong
Were there any tests you
again.
administered to Amber Heard
Please
that were
get her name wrong
designed to
again.
reveal malingering or feigning?
Yes, there were.
Okay, can you please tell the jury about those?
Wait, what?
So malingering is the false production of psychological symptomatology for the purpose of some external material gain. Feigning is the false projection of psychological
cool down for
symptomatology
hunters.
with no identification of what that gain may be. So basically feigning is saying your mental health is worse than it actually is. So I administered 3 of the tests, had validity indices built in that could allow us to address that question. The MFAS, the Miller Assessment, a Forensic Assessment of Symptoms Test, is a specific malingering instrument. It looks at malingering psychopathology. Is this someone, malingering psychopathology? She scored a 0 on that scale. So on that test, sorry, not the scale, that test. So on that test, there was no evidence of malingering. On the TSI, there are 2 validity indices, and she scored within the normal range on those scores as well. One was slightly elevated, but when in testing the limits, because it has rare symptoms and over-endorse symptoms, I determined that also was a valid measure. And then finally, the PAI, the large scale, 344 question instrument, has very robust validity scales on it to test for exaggeration or feigning or malingering, and she did not score in any of those scores and those scales at all. Those were not elevated.
98 to 0,
So the combined results between
probably different
those
tests.
3 tests suggest to me that Ms. Heard is not malingering her psychological symptomatology.
Now, Dr. Curry testified
Oh,
that
here we
one
go.
test showed, quote, intentional exaggeration in the 98th percentile,
Yeah.
meaning that she engaged in extreme levels of exaggeration, end of quote.
Why'd
Do you
that
agree
happen?
with that?
I do not.
Why?
Because that test, the scale that she is referring to is it's called ATR, it's the Atypical Response Scale. As I said, that combines rare symptoms and over-endorsed symptoms. It's very frequently elevated in people who have high levels of distress. And then importantly, on this test specifically, it says, do not use the percentile rank. It is in the manual, it is in italices, because the way that this test was normed, it was normed on people who have trauma. So it's what we call negatively skewed. That means it falls on the tail end of the continuum. It is not a normal curve where we would normally think
That's
of how
not
a
why.
percentile would work. So you would not use the percentile rank on this test.
It's because of the general versus specific questions.
Okay.
You see, like, so that's horse shit. Because the reason why Dr. Curry brought that up originally was because Amber Heard did like, she passed all of the tests where you could easily predict what the outcome of pushing certain answers would be. But then whenever she was given a test where you were not able to easily predict the outcome, the difference was completely fucking different. So it's just that, like...
Dr. Hughes, please continue.
So that is a very inaccurate way to describe that scale and that test. The ATR scale on this test is probably the least robust of our validity scales, so you would never make a comment like that based on one scale if you don't have consistency across data. And when you look at the consistency across the testing with the PAI, the TSI, and the MFAS, and there's research to support that when they go together, you have a higher degree of likelihood that this is not feigned PTSD, that this is not feigned symptomatology. And then actually, if I look at the validity scores on the MMPI-2 that Dr. Curry administered, those scales are not elevated for exaggeration or malingering either. So if I add that, now I have really robust data that Ms. Heard is not malingering or feigning her psychological symptomatology.
That's why they gave her the other test.
Thank you. Did you administer any tests that are specific to domestic violence?
Yes, I did.
Which ones?
So that was the conflict tactics scale, the abusive behavior observation checklist, and the danger assessment scale.
And what did they show?
I would like to refer to the testing.
To refresh
my recollection, just a glance so I can be
that.
clear with the jury.
There's like an implied outcome of putting certain answers on there, and that's what Dr. Curry did the other test.
Overall gist of the testing was that, and the benefit of these tests is that they allow me to ask for what Mr. Depp did to Ms. Heard, and then also what Ms. Heard did to Mr. Depp. So it was asking about both sets of behavior.
What about his finger?
And
Objection, Your Honor.
True.
Back to reading.
She wasn't even looking down. She was looking at the jury.
Go ahead. Go ahead.
Please continue.
So what these tests show was that there was a high degree of serious violence perpetrated by Mr. Depp toward Ms. Heard. There was violence more on the mild level perpetrated by Ms. Heard toward Mr. Depp, with one severe indicator, which was the punching that she indicated to me.
What about the finger?
There were scales about negotiation, about how much this couple tries to figure out their problems. They both scored, again, this is Ms. Heard reporting that, but they both scored in the high range where they're both saying that, yes, we're trying to figure this out, we're trying to work out this relationship. There were scores on the psychological aggression scale where Mr. Depp engaged in more severe acts of psychological aggression, whereas Ms. Heard did engage in also some mild and severe acts of psychological aggression. The amount of injury that was reported was significantly higher and more severe by Ms. Heard, what she was subjected to, And then she was subjected to sexual violence where,
of course, just
Mr.
nobody
Depp,
else can
based on
see
her
it.
report, was subjected to none.
The cops never saw it.
And then
They said the
on
opposite.
the danger assessment scale, that there were a number of factors that were related to
Where does
severity,
shitting on somebody's bed rank?
in violent relationships, and a risk factor when we look, as I said earlier.
Yeah, where does that
when,
rank here?
Behaviors come up on this scale. They're very worrisome, very scary, and we have
It's
to
mild.
take them seriously. So there were a number of behaviors that came up on this scale, such as Mr. Depp threatens to kill her, the increase in severity of the abuse, the forced sexual activity, the choking behavior, his obsessive jealousy.
Objection, foundation.
Talking about the test results.
Overruled, go ahead.
Please continue.
The obsessive jealousy, the control aspect, and his threatening of suicide to kill himself. So those were risk factors.
He didn't even know
that placed
that.
her in the increased.
He was like,
danger
"Wait, I
range.
did this?"
And this is a range that, you know, says that we certainly
surprised.
have to advise women
Okay.
of their risk and consult with law
Really?
enforcement if they're involved, or judges if they're involved, because this means that a woman is at risk for more serious or lethal domestic violence.
So did the results of the psychological tests you administered to Amber Heard support a diagnosis of PTSD?
Objection, leading.
What, if any, psychological tests did you administer that supported a diagnosis of PTSD for Amber Heard?
Sure. So there were 4 tests that supported that diagnosis. One was the PAI, which was that 344 question large scale personality inventory. On that test, her largest subscale, her highest subscale was the one that measures traumatic stress. So that was clinically significant. On the TSI, 2 of her scales were the intrusive experiences dimension and the defensive avoidance dimension, 2 of the classic scales of trauma and PTSD. On the PCL, which is the post-traumatic stress disorder checklist 5, that she scored in all 4 domains of PTSD, and that's an instrument that says how much are you bothered by these symptoms, and in all 4 clusters, which would be the intrusive experiencing, when things about the abuse or the trauma enter your mind when you did not want them to. Sometimes they're cued, sometimes they're uncued. She answered in the avoidance category, which is a second category of PTSD, that I do things to try not to think about this, to try not to feel this, to try not to get upset. Sometimes I avoid certain people because they become a trigger for me. She scored in the what we call the negative alterations in cognition and mood, changes in her thoughts and feelings as a result of the abuse and trauma, and also in the physiological hyperactivity, the hyperarousal, the hypervigilance, the startle response. So on the PCL, she endorsed symptoms in all 4 of those categories, saying, you know, some of these symptoms are bothering me a lot. And then finally, the clinician-administered PTSD scale for the DSM-5. And what that allows me to do, unlike the PCL, is really look at symptom severity and symptom frequency. How is this really playing out for this individual? And similarly, she scored in all 4 categories of trauma and of having intrusive experiences and nightmares and avoidance efforts and physiological hyperactivity and changes in her mood and her thoughts. And her total score was a 28, which falls in the moderate range. So that means that she has experiencing a moderate degree of post-traumatic stress disorder symptomatology. And those tests allow me to make that definitive diagnosis that she suffers from PTSD.
So she made a diagnosis,
Thank
but
you.
the girl's not
what
a
if any
client?
consideration did you give to Amber Heard's
Hold up,
history of
wait a
childhood
minute.
abuse in making your diagnosis?
I mean, that was a significant consideration, given that we know that childhood, well, first of all, we know that people can experience multiple traumas across the lifespan.
Oh, she realized what she was saying
And we wanted
there.
to make sure that the symptoms that she was experiencing were related to what she experienced with Mr. Depp and not her childhood. And certainly, you know, earlier on in the evaluation and when I evaluated and spoke with her, that was true. And that was also true on the latest measure, the clinician-administered PTSD scale for DSM-5, the CAPS-5. And that's because the content, you have to look at what is the content of the symptom. So it's not that someone says, oh yeah, something traumatic comes into my mind. No, what is it? What comes into your mind? What bothers you? What are the triggers? And those were all specific to Miss Heard's relationship with
What the
Mr.
fuck
Depp.
did you think she was going to say?
The reason the childhood is also significant is that we know that if somebody suffers childhood abuse as a child, they are much more likely to have an adult re-victimization. And they're much more likely then to be more vulnerable to obtaining a PTSD, to getting PTSD, if they've had that prior vulnerability. So it's a very strong vulnerability characteristic to obtaining PTSD when you have a subsequent trauma. The other aspect about her childhood abuse is that she was raised in a family of violence. She was physically abused by her father. She saw
Does that
her
mean that she's
father
more likely
abuse
to be
her mother.
violent?
Her father was very explosive and had violent outbursts. And both her parents also struggled with substance abuse very significantly.
Well,
so
she
she
learned
had
well.
learned from a very early age how to caretake, how to live in
I
a
don't think that's what she learned.
that is mired in chaos. How do I take care of a parent who's passed out, knotted out from heroin? And how do I get up and get my sister to school? She learned at a very early age that she had to figure out how to do this in this scenario. And I would say lastly,
She's
what
caretaking
that
by shitting in his bed.
environment taught her was that she learned that she could love someone who hurts her. She knew that people who hurt her also can love her. And she learned how to have this tolerance for cognitive inconsistency, this tolerance for two should be diametrically opposed emotions. But she grew up knowing or believing perhaps that this could happen. And she also believed that she could fix him, just like she tried to fix her father.
Guys, that's not
and just
speculation,
like she tried
okay?
to fix her mother. She truly, truly believed that she could fix Mr. Depp and rid him of his substance abuse problems. But that did not work.
But she wasn't a client either.
Did you review Dr. Curry's CAPS-5 that she administered to Amber Heard?
Yes, I did.
And what, if any, agreement did you have with Dr. Curry's interpretation of the CAPS-5?
I didn't agree with her interpretation, having been a trauma psychologist for over 25 years and administered hundreds of these.
Credibility
I found
time.
that there were flaws in how she chose to administer it, and then some of the coding. Ms. Heard on that CAPS-5 to Dr. Curry certainly reported trauma-based symptomatology related to the abuse by Mr. Depp, but somehow that was not coded as such.
And did you review Dr. Curry's MMPI, too, that she administered on Amber Heard?
Yes, I did.
And do you agree with her interpretations on that test?
No, I do not.
Why not?
Because this profile is a normal profile. There are no clinical scores elevated above 65, which is 1.5 standard deviations of the mean, which is what we use to determine clinical significance. And if none of those scales are elevated, it becomes very difficult for us to make assumptions about a person's psychology and their functioning. Now remember, the psychological testing generates hypotheses about a person that we then, using our clinical judgment, have to make a decision about. We have to make an assessment about it. And if none of those scales are elevated, it just doesn't give us rich information to make those determinations. The one scale which is accurate that was elevated was one that measures defensive responding, sort of a protective responding, an unwillingness
Protective
to
is not the same as defensive.
admit minor faults. That was elevated, and that was true.
What the fuck?
But the result of that is you have a defensive profile. You have somebody who's not giving you a lot of information. So the scales are all low. So there's no way you can take that MMPI and then say it meets, it's consistent with borderline personality disorder. You just don't have the symptom expression on it in order to do that.
And that's my next question here. What, if any, diagnoses did you make of personality disorders for Amber Heard based on your testing?
I did not make a personality disorder of Ms. Heard.
Why not?
Oh my God.
For a number of reasons. Number one, a personality disorder requires a pervasive pattern in a variety of contexts. Two key words: pervasive pattern, variety of context.
Okay.
That means if her emotional instability, her affect dysregulation, or her fear of abandonment is only occurring in the relationship with Mr. Depp, and we don't have evidence of it before, and we don't have evidence of it after, it is not.
All right. Do you want to approach?
Thank God. Thank God we get to shut this shit down. Like, I'm so fucking... What about the previous relationship? I have no idea. Yeah, no, obviously she's got to make Dr. Curry look bad because she got mistaken for Dr. Curry a few times, so it probably hurt her fucking ego. That's clearly what's going on, especially with the thing that she said beforehand. Yeah, obviously that's what it is. And as somebody shitting in her bed, like, yeah, it's like... Here's the thing, is like, what about all of the other evidence that is completely fucking congruent with the other analysis? So you have in one category, you have, okay, well, you know, she said that she was abused. And then you have the other category, she said she wasn't abused. And then the cops said she wasn't abused. There's no evidence for her being abused. There's video evidence of her abusing other people. Like, what about that? You know what I mean? Like, you have to have a, there's like fucking, like, what's the word for this? It's like corroborating evidence. Oh my God. It's perspective. Yeah, it puts perspective. Like, there's no evidence that this happened. And the police even investigated and said that it didn't. Oh my God. That they already went over how she abused her ex-girlfriend too. There is a pattern. I didn't see that. Yeah, I'm not sure. She's reading cheat sheets again. I don't care about her reading cheat sheets. Like, that has no relevance to me. I don't care about her reading the script because it matters what the script says. Like, if she memorized the script before she came in here, would this have somehow been better? No, it would have been the same thing. I don't care about her reading it or not. Amber hit both her ex and her sister. This expert is just outright lying. There's a video of her abusing her own sister on YouTube. Well, I mean, I'm sure that this doctor would have known this, but unfortunately, Amber wasn't a client. And so, you know, this would be impossible data to gather. Like, it would be, like, there's no way you could find out the truth for this, right? Because Amber wasn't a client. So, like, what do you expect? I just... Oh my God. Oh my God. Oh my God. I just... Man, what a cock ass, man. What a cock ass. It's not the job of the expert to care about the Amber shitting in the bed. She doesn't analyze this in her test. It's not the job of the expert. I mean, I feel like it is. Like, if you shit on somebody's bed and you're doing a psychological investigation, I feel like shitting on somebody's bed is part of... I feel like that's... I think that's important. I feel like there's some relevance to that. Yeah, I really think so. I think that's like, you know, maybe, you know, it's possibility, like, it's mild. Yeah, guys, it's mild, guys. Amber dated Elon Musk. I don't know what happened with that. I have no idea. She lied to everyone besides this lady, and this lady thinks she has the most accurate information. Yeah, it's like these things are just like, I just can't believe this is happening, man. Why she's disagreeing with two doctors? Well, what I'm saying is, like, fuck what the doctors say. Which doctor is saying things that's backed up by other fucking things besides studies? They're all tests. Like, no test is 100% conclusive. But like, it's like you move towards 99% certainty, 100% certainty, right? So you first have the tests, and then you also have the videos, and then you have the prior behavior with other exes and apparently with their sister, and then you have shitting in the bed, and then you have the pictures of Johnny whenever he got his fucking face hit. What do you think? He punched himself in the face? Give me a break. Like, it's just unbelievable. And also, by the way, still, at this point, we have not had the question, did you receive monetary compensation at any point, or any type of compensation, or some degree of, quid pro quo from Amber. Like, this has not even been a question. Like, how the fuck was this not a question in the first 5 seconds of the testimony? Oh my God. I just, oh my God. It'll be a cross question. I feel like every other witness at the very beginning disclosed their relationship. Am I right about this? Every other witness at the very beginning disclosed their relationship with the person that they are involved with in the trial. Am I right? Every single one. This one, it's not. Where there's smoke, there's fire. I don't believe in these coincidences. I think these people are very smart. I think that they know exactly what they're doing. And every action that is taken is not a mistake. Yeah, every action, yes, patterns exist. These people are not stupid. It's not necessarily defense lawyer doing it because they're being authentic. Heard's side is no case, so they skirt around it. Exactly. That's my point. God, oh my God, bro, like, it's just, it's taking Amber's testimony as fact. I'm so annoyed, man. I really am. This is Heard's side trying to control the narrative after Curry showed the light. Cross-examination will show a lot of this bias. Well, I hope so. No, I do. I can't wait. I'm so excited. This is gonna be great. Like, it's just like there's so many other cases. You know what I mean? Like, there's so much other evidence the other way. Like, it's just too much, man. How are the plants doing? One of the plants was depressed this morning because I didn't water it. I've watered it now, and it's doing a lot better. It was very upset with me this morning, but we've watered it, and it's doing okay. I'll show you guys real quick since they're just fucking arguing. All right, give me 1 second. It's actually doing really well. The other one is doing... the other one's doing way better. See, look at that. Like, these right here are not happy, but I think that after they get watered more, like, these leaves were very unhappy this morning, and now they're in a better mood. So we're actually doing pretty well here. I'm going to turn it around so the plant grows the other way. There we go. So yeah, I think it's going to be okay. It's a healthy boy. Yeah, exactly. I want Johnny's lawyer to ask him some good questions. It's just like, I am Omega Malding, man. Like, I really am. It's just such obvious horseshit. It's such obvious, plain, clear as day horseshit. And I don't get it. We'll see Miss Heard on the stand. Why? She's just gonna lie. She's just gonna lie, and like, she has plausible deniability that she doesn't remember things properly because she had a diagnosis of PTSD, and PTSD means that you can forget things and it's not always your fault, or misremember things. So she's just gonna lie. Like, it's not gonna happen. Like, it's a waste of time. You see, like that? See, you see what I'm saying? Like, I can see the fucking games these people are playing. Like, it's obvious. It's fucking obvious. Oh my God, man. The cross-examination stops this bullshit? Yeah, we'll see what happens. The witness is biased? I agree.
Dr. Hughes, what, if anything, did Dr. Cowan say to you about any type of diagnoses of personality disorders?
Dr. Cohen did not diagnose Ms. Heard with any personality disorder.
And what, if anything, did Dr. Bonnie Jacobs say about diagnosing Amber Heard with any personality disorders?
And Dr. Jacobs similarly did not diagnose Ms. Heard with any personality disorder.
Thank you. Now, let's turn back to intimate partner violence. What types of physical violence were reported to you?
So there were a number of physically violent behaviors that were reported, that Ms. Heard reported that Mr. Depp perpetrated. He pushed her, he shoved her, he slapped her with the front of his hand and the back of his hand. He choked her, he slammed her into the wall, he pushed her and she fell down. He kicked her in the back.
What is this,
Without
MMA?
looking at my notes, that's what I can recall.
Kicked her in the back?
And what type of
It's a 58-year-old
injuries did
man.
Amber Heard report to you?
She reported mostly bruising, pain, some cuts. She reported vaginal pain from some of the sexual assaults. She reported that she did have some scratches and cuts on her from broken glass. She reported
because she hurt herself
believed
breaking
she may
it and
have
throwing
lost
it at him.
consciousness
That's true.
2 times, once in
yeah, it probably
the
was from broken
Australia
glass.
incident and once in the December 15th, 2015 incident.
What type of coercive control was reported or did you find?
Leading.
Sustained.
What, if any, coercive control was reported to you?
So the coercive control that was determined in this relationship I found to be quite significant. There were many, many instances where Mr. Depp tried to control how Ms. Heard went about her career. He didn't want her to show nudity. He didn't want her to show boob. He didn't want her to act with certain actors because of this obsessive jealousy. He criticized her ambition. He'd rather she not work. He called, the ambition as something as a negative thing. It made her very fearful to have to look at scripts or talk about scripts or talk about movie roles because he persistently put those down and told her she didn't need to work and she didn't need to do that and she didn't need to show her tits and ass. He didn't necessarily support her work. The way this manifested as well is that he called almost every actor that she had to work with, males and females. So no matter what show she was filming or shooting, he would call the leading actor. He would call the director. He would tell you, I got eyes down there. I got eyes down on the set. So she never felt safe to be herself and be an actress in these films or productions because she'd have to come home and then endure his anger at her for doing something.
Yeah, where's the proof? Where's this hearsay? Like,
when she was filming and he was in the same town, she feared that he would show up on the set and, to know what her call sheet, what she was filming that day. She even told her assistant, don't give it to him, don't let him see it so that he won't show up. And sometimes he did. So it was very trepidatious for her and very anxiety-provoking that he continued to do this. He tried to control what she wore. When she was going out with him, things were fine, but he told her often, no woman like mine is going to dress like a whore. And he didn't want her to wear revealing clothing, or revealing clothing according to him. She recalled an incident when she was going on a job audition, and she said,
God,
you're going to go out with those tits and ass, and she had to sort of go in and put on what she said mom jeans so that she didn't look sexy, so she didn't look revealing, and continued to try to plead with him about what jobs she could take and she could not take. This made her be very sort of restrictive and try to conceal things. She would hide her scripts because she couldn't read them in front of him because he would put them down or want to see where there might be nudity, where there might be something where she's doing a love scene. And then almost every person that she was in a film with, there would be those barrages of the consistent accusations of infidelity. And we saw that on the Australia pictures, the Billy Bob. He was one person that he continued, to berate her about having an affair with. That's what obsessive control looks like, those messages on the mirror. When you look at how he wanted her to there was some
Billy Bob.
interference with the family, with her sister. When some things were leaked, he was obsessed, believing that it was Whitney who did it, and eventually Miss Heard had to succumb and say, okay, yes, it was, and then alienate herself from her sister because she just couldn't take the fights anymore. She just couldn't take the constant barrage.
More like her
of
sister couldn't take her fights.
So there were many instances when, in terms of their interactions, she would have to text him right back, but when she would text him, he could not answer for days. And it's this sort of, when we talk about, the ghosting, but your husband doesn't ghost you, your partner doesn't ghost you. And there were so many times of this sort of withdrawal of affection, which was on his terms and when he wanted to do it. I'm aware that there is, testimony in this case that, Mr. Depp decided to leave because he didn't want to be violent.
He didn't want to have his bed shit on.
I think he did leave in times where he didn't want an altercation. He did leave after an altercation. He did leave and then came back and continued the altercation. So leaving wasn't the defining variable. The problem was that, with this obsessiveness and this perseveration that he had, the fight would always come back. So leaving might end the argument for that moment, but Miss Heard knew he was always going to come back, and he was going to, start the interrogation once again.
Well,
And
that's
what
great.
is the effect of the coercive control on Amber Heard?
I'm glad we have a lot of evidence for that.
I mean, the effect was
Yes.
drastic. She talked to me that
Absolutely.
her roles consistently dropped
How-
over the time that she was in the relationship with Mr. Depp, just because it was so difficult to go on auditions, to want to be in a different location with him. Whenever she was not on location with him, it was very stressful. It was very anxiety-provoking because of the accusations of infidelity. We heard that through Isaac Baruch's testimony when she called and was saying, babe, there's no one here, there's no one here. That was something that she had to do repeatedly and constantly over the course of the relationship. So it caused a significant amount of anxiety, of distress, of having to try to conceal and maneuver around him to try to have the career that she wanted to have. It made her hypervigilant, and definitely contributed to sort of her psychological symptomatology getting worse over time.
What about sexual violence?
So there was a number of incidents of sexual violence reported in this relationship. Those are documented early on in Dr.
Like
Bonnie
shitting
Jacobs' notes.
in his bed.
Where when Mr. Depp was drunk or high, he threw her on the bed, ripped off her nightgown, and tried to have sex with her. There were times when he forced her to give him oral sex when he was angry. These weren't in loving moments. These were angry moments, moments of dominance, moments of him trying to get control over her. There was a time when they were in Hicksville in the trailer, I don't want to say trailer park, but I guess there's trailer park. It is a trailer park, where he was
Not
accusing her of a woman hitting on Amber, and that was the problem. Amber got accused of women hitting on her, and it got accused of men hitting on her. So there were so many targets that came through in his obsessive jealousy. But when he, on that incident when Kelly Sue was accused of hitting on Miss Heard, and they went back into the trailer, Mr. Depp performed a cavity search and ostensibly was looking for drugs and felt it acceptable to rip off her nightgown and stick his fingers up her vagina to look for cocaine, felt that maybe she was hiding them there. And again, these incidents often happened in a drug-fueled rage. There was another incident in the Bahamas where when he got angry, he took his fingers and he put them in her vagina and moved her around violently in the closet. Again, an act of sexual violence. And of course,
I'm sure that's true, just like everything else she said is
one
true.
of the most severe instances of sexual
I'm
violence
sure that's
that,
totally true.
Miss Heard had to endure, in which when he was beating her and choking her and telling her, I'm going to fucking kill you, I hate you, I'm going to fucking kill you, and he grabbed a bottle that was on the bar and penetrated her with that bottle. And Miss Heard reported to me of dissociating and going outside of her body, and the only thing she was thinking is, oh God, I hope it's not the broken one.
That's beautiful.
What if any psychological
That's beautiful.
abuse?
Let's all give a standing ovation for that performance.
There was a number of psychological.
Yeah, let's give a
abusive
standing
behaviors,
ovation.
as I
That's
stated.
incredible.
You know, Miss
Wow.
Heard admitted to me and reported that she engaged in those behaviors as well.
Apparently she took acting
reported
lessons
that
from Amber Heard.
Did call him names and offensive comments and said things to him that were horrible, and that she was incredibly saddened and horrified by her behavior. And looking back, she, at this point, not being in the constant barrage of abuse, does not recognize her. The abuse by Mr. Depp, he called her a number of names, frequently whore, slut, cunt, lesbian camp counselor, you know, easy.
Camp counselor?
Ambition was a weaponized term in that relationship. So he called her a lot of names and humiliated her. And of course, I think we talked about the intimidation tactics that, you know, Mr. Depp was often banging and
Proof?
throwing.
No, there's no proof.
And hitting things in the household.
Yeah, there's no
which
proof,
sort of
guys.
Got the tension to.
There's only proof of the stuff that
rise
she
up
does.
very significantly, very quickly.
Crazy how that happens.
Can you tell me how you conducted your analysis?
Is that
or arrived at these
insane?
conclusions?
Sure. So what I did was look at the incidents that were reported and look at the corroborating data around it. So as we stated, most of these incidents of intimate partner violence happen behind closed doors. Not everyone is going to witness what the parties are reporting behind closed doors. So you look at what is the data that surrounds it. Is there any data before it? Is there any data after it? Is the person telling? Is the victim telling somebody in real time about what's happening? Are there therapy notes? Are there pictures? Are there text messages that sort of allow us to fill in the pieces of the picture, even though we don't have exactly what happened at that moment? The more collateral that we have and the consistency across those data points, it gives us greater confidence in our results.
Can you give us some examples?
Sure. So
Vague.
Ooh.
Overruled, I'll allow it.
So, for example, the Boston plane incident, I believe, without looking, I know May 24th, 2014. This is the incident where Ms. Heard and Mr. Depp were going to fly back to LA and spend the weekend together. They were shooting at different sites. Ms. Heard is on the plane waiting for Mr. Depp to come on in the tarmac. He's reportedly sitting in the SUV, smoking and drinking, smoking weed and drinking. She is filming with James Franco at this point, and she gets on the plane and he starts talking about James Franco, you know, making a lot of derogatory comments about her, and you know, I hope you had fun with your escapades, and some more inflammatory language. And then in an argument, when she got up to leave, he kicked her in the back and she went forward on the plane. To the front of the plane because he sat in the back of the plane.
And I'm sure there's
so if
evidence.
I look at what is the corresponding data to this.
And witnesses for this.
There's a therapy note, several notes in Bonnie Jacobs' records that talk about Mr. Depp's increasing use of alcohol and his obsessive jealousy around
Yeah,
James
no
Franco
one saw it though.
before this Boston plane incident. After the incident,
He
Ms.
sparred and
Heard
kicked her?
told
Yeah.
her friend Io. She told her friend Savannah. She told her friend Rocky. Ms. Heard did not go home.
He's like, what the fuck is she
was
talking
afraid
about?
To go home. So she went to a hotel because when Johnny was in these states, he would often show up because he's still in that drinking and drugging phase. And he talked about that. That was the roxicodone before he detoxed. You know, he was still in that, you know, high substance abuse phase that he would often show up at night, and that did not feel safe. There was a text from Stephen Juders, Mr. Depp's assistant.
All right. You want to approach?
I'm so sick of this shit, dude. Like, it's just, was like John was dating her? Yeah, no, it's just nuts. Like, she's just making up all this bullshit. Like, I would believe it if there was evidence, but there's like, it's just, isn't it weird how there's no evidence for all of the bad things that he does, but there's always evidence for all of the good things, like, is it, all the, like, I'll be right back. Sexist towards men? Well, it's like, it's not just that. It's like her dramatization of it, you know? Like, it's just, you know how she said, like, oh, I hope it's not the broken bottle? Like, what the fuck? Like, that's some, like, that's some weird, crazy-ass shit. And like on top of that, it's like, yeah, it's just like the alliteration and the, you know, like the narrative of it and all of that. Like, what the fuck? She's telling a story. Like, the fuck? Like, yeah. How she emphasizes it, yeah, it's just fucking bullshit, man. M. Tane, thank you very much for the 10 gifted community subs. I appreciate that. Thank you, thank you, thank you. Is that allowed? Talking that bullshit on court and not being accused in USA? I don't know. I think it might take a little bit of time, but I think they'll figure it out sooner than later. That's kind of what I'm expecting. It's just going to take some time. Amazing how I remembers. Oh, yeah, she remembers all of this stuff, but she's not a client. Why do you care about this shit? Because it's bullshit. That's why I care. It's fucking bullshit.
All right, so, Dr. Hughes, let's go past that text and talk about, go past that text and continue after that text.
Sure. So there was, Mr. Depp apologized to Ms. Heard for that incident. Mr. Depp said in his UK testimony, well, I only maybe playfully tapped her on the back with my foot. Mr. Depp texted Paul Bettany and talked about how he was so drunk and out of control and engaged in bad behavior. He texted his friend Patty Smith a very similar type of text about how drunk and out of control he was. And then finally, Amber Heard wrote an email talking about how distressed and heartbroken she was.
Objection, hearsay.
I mean, I don't agree.
I know. Sustained. I'll sustain the objection. Next question.
Can you give another example?
That's right.
I think those are all I can remember at this point.
That's right. Okay. Oh my God.
What if any, sorry, I'm going to have to go a little bit further here. So you concluded that Amber Heard used psychological abuse and some reactive physical violence, I think I heard you say. Is that correct?
Objection, leading.
Overruled.
Can you please explain to the jury what you meant by that?
Yes, that is correct. That, you know, Amber Heard reported to me some of the behaviors that she used that were psychologically aggressive, the name calling, the putting him down and calling him very bad names and insulting his fatherhood, and she was very shamed and remorseful about that. She also indicated, you know, using, and as some of the testing showed, minor forms of violence, pushing, shoving, throwing objects. We see that a lot with women when there's not proportional force. Women are more likely to throw objects. And then the more severe act of punching him, which a punch falls in the more severe category.
Yeah, I would say
so. The context, as she explained it, was that he was coming after Whitney, and she stood, her sister, and she stood in the way and she punched him.
Now, does that make Amber Heard a perpetrator of intimate partner violence?
Yes.
Objection, leading.
Overruled.
So that was one of the tasks that I had to consider. That was one of the hypotheses that I had to consider. And given all of the other data, that was not my opinion.
Okay.
So hitting somebody
now,
and throwing things and punching them isn't...
Of therapy records.
How is that not?
Why are therapy records important?
Therapy records are critical for a forensic psychologist. When we have the opportunity to go back in time and see what a person was dealing with, what the content of their distress was, and what the symptoms of their distress was, it really gives us a snapshot in time. So they become very critical as part of the overall forensic psychological evaluation, because we as psychologists understand how people sort of treat in therapy and what to look for. So in looking back at Ms. Heard's therapy records, we see sort of real-time unfolding of this dynamic in this relationship. We see early on in her notes in her report with Bonnie Jacobs and in Dr. Bonnie Jacobs' notes, reports of constant concerns about Mr. Depp's substance abuse, constant concerns about him passing out and vomiting, constant concerns about not wanting to...
Objection, Your Honor. Hearsay.
She can characterize that and say she relied on that.
Overruled.
Thank you. Please continue.
Constant concerns about how do I get him into treatment? How do I get him help? Ms. Heard starts going to Al-Anon at this point, early 2012, in the beginning of the relationship, because she has to figure out and wants to figure out a way to support the man that she's dating right now and the man who she's falling madly in love with. There were reports in Dr. Jacobs' notes early on about his controlling behavior, about his jealousy behavior, about him not wanting to do certain jobs, of not wanting her to wear certain clothes. So this is going back to 2012. With no indication of why would she be saying that, but for the sole purpose of trying to get help and trying to get guidance in this relationship that she finds so difficult. There are indications, as I mentioned before, of the sexual assault and the sexual abuse and how he would, you know, when he was angry and when he was drunk, it was mostly drug and alcohol fueled rage when he would, you know, throw her on the bed and try to have sex with her. And then, you know, if he was not able to perform, he would get more angry at her and blame her. So we have this dynamic of blaming her for his inability to take responsibility for his behavior.
What
Those
a bunch
themes
of...
were throughout Dr. Jacobs' notes.
Oh my God. Where's the proof? There is none. There's no proof.
Did Dr. Jacobs assign any diagnoses to Amber Heard?
She did. Early on, she diagnosed her with panic disorder, and then later with post-traumatic stress disorder.
Oh my God.
Right. And did Dr. Jacobs diagnose Amber Heard with borderline personality disorder?
No, she did not.
Histrionic personality disorder?
No, she did not.
And is that important?
That's very important when we're trying to figure out the course of somebody's illness, the course of somebody's psychiatric difficulties. As I stated, well, I don't think I got to state, personality disorders usually start in adolescence early.
Objection.
I'll sustain the objection. Next question.
Okay.
Yep. Shut it down.
You also stated that you reviewed Dr. Connell Cowan's treatment notes, correct?
Correct.
And you also read his deposition testimony?
Correct.
And you had how long of a collateral interview with him?
I believe it was 2 hours.
Okay. And
get him out of here.
What did you get from all of that data?
So by the time that she gets to Dr. Connell Cowan, which is 2014, I believe, September 2014 is when Dr. Kipper comes on the scene. Ms. Heard's psychological functioning is significantly deteriorated. She's suffering more anxiety, more sleeplessness, more agitation, more emotional dysregulation, this fluctuation in moods. And when you sort of look at the records of what happened in those first 2 years from Dr. Jacobs, and now we have up to Dr. Connell Cowan, and we see all of the incidents that she was exposed to, including the sexual violence and the coercive control.
We see? No, we don't see.
That her status, her
That's the
psychological
problem.
functioning has deteriorated. And in Dr. Connell Cowan's notes, that's what he's always trying to do. He's trying to help her, help Mr. Depp, help her act in a way so that Mr. Depp does not hurt her. Dr. Connell Cowan was very concerned for Amber Heard's safety, as was Dr. Bonnie Jacobs. Dr. Jacobs was very concerned for her safety, and she continued to talk about safety aspects for Ms. Heard, as was Connell Cowan. They did, both of them, both therapists, understood, and Ms. Heard talked to them about it, that there were times that she fought back and she used violence and times that she screamed and she said things that she didn't want to. But nevertheless, that did not change the balance for them either, and they were very concerned that because of Mr. Depp's significant substance abuse and his sort of poorly controlled anger, that at some point he was going to seriously hurt her.
And then why is his finger gone
Dr.
and
Cohen
hers isn't?
Provide Ms. Heard with a diagnosis of borderline personality disorder?
No, he did not.
Did he
But isn't that
diagnose
interesting?
Amber Heard with histrionic personality disorder?
No, he did not.
Is that important?
It's important that you have an individual, Ms. Heard, who's in therapy for over 2 years with one therapist and over 2 years with another therapist, and you're not seeing those characteristics of a personality disorder. If the manifestation of a person's difficulties and illness and symptomatology is better explained by another disorder, then you don't qualify for the personality disorder. You can't get the diagnosis. I mean, that's part of the criteria. So if it's not a pervasive pattern in a variety of contexts, and it can't be better explained by her trauma experience and the exposure and the symptoms as a result of that trauma, then you don't get a personality disorder. And that's why they didn't diagnose it.
Did you read Dr. Amy Banks' deposition testimony?
Yes, I did.
And what were her findings?
So Dr. Banks had one session, one couple session with Mr. Depp and Ms. Heard. Dr. Banks is very reputable. She works up at the Harvard Medical School Cambridge Victim of Violence Program,
nice.
which is a very well-known program for understanding.
Objection, Your Honor.
What's the objection?
Shut the fuck up and get
It's
to the
not
point.
responsive to the question. The question was, what was the findings?
All right.
Tell the jury who Dr. Amy Banks is.
And just like I said, so she's somebody who has a wealth of experience in understanding intimate partner violence and the dynamics of violent relationships. But she only had one session with the couple, and it was her determination when they were both there and the violence was talked about that Mr. Depp did not deny the violence that he perpetrated toward Ms. Heard. She also did, as everybody has, all of our other therapists, because Ms. Heard admitted as such, that she also used low levels of violence as well. So Dr. Amy Banks had that opinion.
Did you review Dr. Laurel Anderson's treatment notes and read her deposition?
Yes, I did.
Okay. And
That's
what was the
crazy to do all this for
significance
somebody who's not
of
even a client.
What you learned from Dr. Anderson?
That is crazy.
So
wow.
Dr. Anderson similarly
Ain't that
thought
something?
that there was violence and abuse in this relationship. She was the one therapist out of the four who qualified it as mutual abuse, which the termination I've talked to
She's
you about.
not using
I
the notes
don't
here either.
necessarily agree with. But she did see and did understand that there was violence and abuse by Mr. Depp. What was most notable was that after the December 15th, 2015 episode, Ms. Heard called her, in addition to calling Connell Cohen, and reached out to a number of people. But she saw Dr. Anderson in her office, and Dr. Anderson saw 2 bruises on her face and told me, my husband kicked me, and he pushed me, and he punched me in the head. And should I call the police?
Objection, Your Honor.
What should
You're
I
saying.
do?
She's not reading, Your Honor. She's just saying the significance.
Sustain the objection. Next
Okay.
question.
All right. What were
She's
your,
going on a performance again.
What conclusions did you make as a result?
She should
of
be a
Dr.
better. She should
what
be an
you
actor, not
reviewed for
Amber
Dr.
Heard.
Laurel Anderson.
This is great. Yeah.
My take
It's an audition.
reading Dr. Laurel Anderson's deposition and seeing her
Biscuit, thanks for
redacted
5
notes was that, from my
Just have her play an
professional opinion,
Aquaman
this
2
was a
instead.
very serious incident and a very serious allegation of intimate partner violence by
see that.
Mr. Depp. If a patient comes into my office with 2 bruises and alleges being pushed, shoved, and kicked by her partner, I'm going to be very concerned, and I'm going to mobilize a lot more resources to help that individual. And for some reason, that did not happen for Ms. Heard.
What are your overall clinical impressions from reading these notes from Amber Heard's treatment providers and their couples therapists?
Objection, compound.
All right, sustained.
What are your overall clinical impressions from reading what you told everybody you read?
Objection, compound.
I mean, I don't know how to get it less compound, Your Honor.
Overruled. Go ahead.
Thank you.
So my overall impression of the treatment notes was, there's significant support for the fact that there was intimate partner violence in this relationship.
There certainly
It
was.
was consistently reported over time, and there were couples therapists who saw and understood that. There were. Mr. Depp also attended a session with Dr. Connell Cohen with Ms. Heard. And in that session, he was very belligerent and mean and yelling and intimidating, and he even got up and stormed out, rolled a joint, and then came back later. Dr. Connell
That
Cohen's
part I
impression
can
was
believe.
this is somebody who's poorly controlled.
Yeah,
That's
I
the
can
same
believe
thing
that.
Dr. Laurel Anderson said about him. And he stormed
Yeah.
out of one of those sessions, too. So there were a total of 6 sessions, couple session, but Mr. Depp stormed out of 2 of them. So there were only 4 couple sessions for these 2 individuals in this just highly volatile, highly damaging relationship that was, you know, punctuated by the coercive control.
This
and
is
the intimate
unreal,
partner
man.
violence.
What, if any, observations did you make about Amber Heard's psychological status
Unreal.
over that period?
I mean, the record was very clear that her psychological status deteriorated as she was in the relationship with Mr. Depp. She kept getting worse. She was losing weight. By the end, she was down to, I think, 105 pounds from about 125, 130. She was taking significantly more medication than she's ever taken in her life. She was having more panic, more anxiety, more distress. More affect dysregulation, just really an inability to regulate her mood, more anger outbursts. So it can significantly deteriorate over time.
Okay.
You talked about weight. What, if any, diagnoses did Bonnie Jacobs make about Amber Heard having an eating disorder?
There was no evidence in the record that Ms. Heard had an eating disorder.
What, if any, observations did you make about whether Dr. Cowan Connell thought she had an eating disorder?
There was no indication in his record that she had an eating disorder.
Okay. Now, what, if any, observations did you make about the impact of Mr. Depp's substance abuse?
So the substance abuse was
here
a
we go.
very relevant and complicating factor to this relationship. When you pair that level of substance abuse with the level of intimate partner violence and coercive control, it's a very, very disastrous mix. And one of the things that happens with the substance abuse is a very similar dynamic that happens with the intimate partner violence. That there's the lying, there's the hiding, there's the cheating, there's the obfuscation, the rationalization
Oh
about
my
the
God,
drinking, the
man.
rationalization about the violence, the trying to, promises, I'm going to do better, I'm going to get clean and sober, I'm not going to hit you anymore.
Objection,
So
Your
all-
Honor. Can I be heard?
Everyone approach?
Thank God. Holy shit. Like, I mean, again, like this girl, like this lady just goes on like a rampage every time. Yeah, like what the, it's exhausting to listen to. Yeah, these performances, she hates men. Well, it's obvious that, as I said, with her language, the language that she uses, I think, is an indicator to how she looks at these situations. And the language that she's using is that women are victims and men are abusers. She's saying what she thinks. This is what she normally does. She's part of numerous groups that are advocacy for women specifically. And then she gets added onto here, and she's doing this alliteration performance of how bad Johnny Depp was. Meanwhile, what's so funny to me about this is that, like, you have, like, so let's say Johnny Depp yelled at her or something like that. Well, like, I mean, we have the evidence of, like, Johnny Depp's finger's gone. Like, part of his finger's gone. Like, that's kind of a big deal, Like, you can see that. Like, where is the evidence of any of these things? That's what I'm saying. Like, it's so, to me, like, I don't really believe anything that people say, period, right? Because people are going to say what's going to be beneficial to them. That's always what happens. But whenever there's evidence and there's the same people saying the same thing, wow, if it walks like a duck and it quacks like a duck, you know what? Maybe it's just a fucking duck. Like, trust but verify. Yes, exactly. It's just... her credibility went down the drain the first 5 minutes. I mean, spewing accusations without any evidence. Yeah, like, how can she put up all of these accusations and there's, like, literally no evidence for this? There's no video of this. There's no witness testimony for this. It's just bullshit. All right, here we go.
What, if any, dynamics and coping styles are connected to the substance abuse by Mr. Depp?
So they share similarities. There's
Getting
a lot
his
of
bed shit
lying
on?
when somebody's a substance abuser. There's a lot of hiding. There's a lot of concealment. There's a lot of rationalization. There's a lot of blame. blaming your partner for your inability to stay clean and sober. There's a lot of the promises to change and the promises to get better. So a lot of these dynamics sort of co-occur, in a situation of substance abuse and domestic violence. They're very similar. The difficulty in this relationship was that the majority of the violent episodes and the sexually violent episodes were in these alcohol and drug-fueled rages. That was predominantly when those happened. When he wasn't in those stages, we still saw the obsessive jealousy and the coercive control and the possessiveness. That still persisted. But when the alcohol and the drugs came together is when Amber Heard was more in danger of being hurt by him.
Oh my fucking God. More in danger.
Why didn't Amber Heard leave the relationship sooner?
Well, I mean, you know why.
Objection, speculation, Your Honor.
It's obviously speculation.
Have you formed, based on your experience and based on your 29 hours of clinical evaluation of Amber Heard, what is your understanding of why Amber Heard didn't leave the relationship?
Not a client.
Objection beyond the scope of the disclosure.
It clearly is not. I mean, it's clearly in the disclosure. Point to where you say it's not. I mean,
Point to where you say it's not.
You're
Could you come forward?
They get through one question. All right, let's go back. Yeah, prove a negative. It's just, point to where you say it's not. Point to where it isn't. Prove how it's not there. I just, what's this for, Jen? Let me see. Yeah, I'll read this afterwards. There's actually a lot to say about this. That's good to see. What a bunch of horse shit this is, man. Like, and also, how is she able to just fucking go on this rant? How many hours have we been listening to this? How many hours have we been listening to this piece of shit give out this bullshit? It's been 2 or 3 hours with no contesting this, no nothing. Like, too many? Yeah. I mean, really. This is unreal. Here we go.
Now, you indicated that your main opinion was that Amber Heard's report of violence and abuse in her relationship with Mr. Depp is consistent with what is known as intimate partner violence, correct?
That's correct.
Okay. And why did you believe that Amber Heard, what formed your basis of that opinion, in a nutshell?
Asked and answered, Your Honor.
Overruled, I'll allow it.
The basis of the opinion was looking at all the dynamics in this relationship, looking at not just the hitting and the yelling, but looking at how much more hitting was done, looking at the coercive control, the obsessive jealousy, the possessiveness, the sexual violence, the choking behavior, the threats to kill. Those are all, as I stated, very significant and often found in cases of lethal domestic violence. Those were significant severity factors, and looking at all those, that's what tipped the scales, that even though she yelled and said some horrible things and hit him, it never was able to shift the balance of power and control in that relationship.
Balance of power. Like, oh my God.
You have discussed with Amber Heard and you have reviewed and evaluated.
What the fuck are you talking about?
Emotional impact on Amber Heard as a result of emotional distress as a result of the 3 counterclaim statements.
Oh my
correct?
God.
The 3 alleged
She worked for
defamatory
Activision?
statements made by
Is this
Mr. Depp
true?
through Mr. Waldman, correct?
That is correct.
Okay.
Objection,
And-
compound leading.
Just
Overruled, I'll allow it. Go ahead.
Thank you. Thank you. Could you please tell the jury what psychological impact these statements had on Amber Heard?
Yes, so there were 3 statements that I evaluated. May I check my notes to give you the dates and my recollection so that I can be clear?
Since I couldn't put it in, this might be the fastest way, Your Honor.
I'd rather she not address the court. I mean,
I'm sorry. Yes.
Okay.
Yes.
So there were 3 statements on April 8th, 2020, April 27th, 2020, and June 24th, 2020 that I queried her about and asked her about. The one that, what happens is if somebody who, like Ms. Hurd, has trauma-based symptoms and PTSD, we say that PTSD is a cue-based disorder. There are things that happen in the environment that trigger it and make it worse. And have to refute that your report of violence and abuse is a hoax makes that trauma activated. So it makes the PTSD symptoms at that time become more intense and more severe. So she would have more intrusive thoughts, more nightmares.
So it's people's
more
fault for questioning her?
More difficulty engaging with other people, depression, sadness, stress. All of that would happen when one of these statements came out.
Oh my God.
The one that was, the most difficult was the one where they said that her sexual violence
Objection, Your
was
Honor.
a hoax.
what's the objection?
I think she's going to the, to.
Oh, I'll overrule objection. Go ahead.
Please continue.
The one that was most difficult for Ms. Hurd was the statement about calling her sexual violence a hoax. As I stated earlier, most women try very diligently to put that sexual violence in a box, bury it down, not want to talk about it, not want to have anything related to it come up. And, she's done, by my estimation in her coping, although she suffers from post-traumatic stress disorder, she also has a high degree of coping strategies. But when this would
like
happen,
shitting in a bed.
it sort of would just, everything would deteriorate. And this is the one thing that women are always afraid of, that no one's going to believe them. No one's going to take them seriously.
But that's what she literally
when
said to
somebody
Johnny.
comes out in the popular media
She literally
and
said
calls
the
your
same thing to him.
experience a hoax that lended itself
Implying
to,
that's not
more
what she
severe
believes.
psychological and traumatic symptomatology for her.
Dr. Hughes, are all
What a
of your
lying
opinions
bitch.
that you have provided today
I can't believe
within
this.
a reasonable degree of psychological probability or certainty?
Yes, they are.
Thank you. I have no further questions.
All right. Ladies and gentlemen, I think this is a good time to go ahead and break for the day. We can have cross-examination and redirect tomorrow of this witness, of Dr. Hughes. So if you could have a good evening, do not discuss the case with anybody, and don't do any outside research, okay? And we'll see you in the morning.
That's good.
Thank you.
That's good. That's good. Boys, I cannot wait for tomorrow. Holy shit, I cannot wait for tomorrow. Oh my God. Oh my fucking God. Tomorrow is going to be a bloodbath. I hope you know that the judge actually did Johnny's team a favor by doing this, right? Because now she gave them an entire day to formulate a case about
Dr. Hughes,
this.
since you're still in the middle of your testimony, please
She
don't discuss
actually
your
helped them out a
testimony,
lot.
including the attorneys, okay?
By, like, not
And
cutting it
anything
short
that
or
you
anything.
looked at, referenced during your direct examination, if you could just turn that over so they
Yeah.
can review that before cross-examination, okay? All right, thank you, ma'am.
I am just, oh my God, bro. Like,
I presume she wants to be able to take that back with her.
We can get copies of it. We'll get whatever.
Oh my
it is.
God.
Okay, we'll make sure you get.
They're gonna,
copies
like,
of
bro,
it, so
like,
you
she
can
is gonna
copies
get
of it so you can keep her
destroyed.
originals. Okay.
Yes.
Like,
Thank
I cannot
All right.
wait for this, man. It's gonna be such a, it's gonna, I cannot
No,
wait.
No. We're not
I might go to
right
bed
now.
early
Of course,
tonight.
it's- Thank you. All right. So
I'm like, I gotta go to
so
bed
we'll see you
early tonight so I can
tomorrow
wake
at
up for this
10 a.m.,
horse
correct?
shit tomorrow,
All right,
man.
Thank you.
What time? I don't know. I'll be on at like 9 and as you morning, right? I mean, I'm always on early. Like, check her WebMD reviews. Who gives a fuck about that? But like, I'm just saying, like, check the picture of the shit in your bed. Yeah, it's like, well, like, bro, I just can't fucking understand this. I really can't. Like, it's just nuts. Oh my God. What did I miss? It's just that this whole thing is just so fucking, it's so disgraceful. It's so absolutely fucking disgraceful. And the fact that, like, she's able to ask these questions to this person who's just like, I mean, every other person has been on for, like, I don't know, 30 minutes. This woman was on for 3 hours. 3 hours. And like, again, what I think is so fucking indicative of this is the fact that every single thing that she's said has all been completely unsubstantiated. Nothing that this woman has said has been validated, verified, or in any capacity whatsoever. Meanwhile, you have the exact opposite with video evidence. And also, like, you have a police report that says the opposite. That's what I find to be so fucking ridiculous about this, is that it's not only the doctor's getting review bombed. I don't care about getting review bombed. I think that's silly. They're just gonna delete them, and they should. But like, what I'm saying is that, check if she's a feminist. I don't care if she's a feminist, but it seems very obvious that, like, listen, whenever you're using gendered language, that's all you're using is your gendered language. And did you see the part where the lady, the psychologist, whatever, she said whenever Johnny left because he didn't want to be violent? Did you hear that language? Did you hear that? Like, I don't know if you guys, like, I actually wrote that down. Because, like, yeah, it's like he left because he didn't want to be violent. How the fuck is this? Like, I can't believe she's a woke psychologist. I studied gender studies. She's super biased. It's like, how is this? It just makes me so fucking mad. I hope that people can see it now, how obviously biased this is. Yeah, in her eyes, only men can do wrong. But that's not in her eyes, in her words. Like, she spent 30 minutes explaining the dynamics between a victim and abuser through the language and the lens of men and women. Men are the abusers, women are the victims. Like, that's literally what she said. Yeah, and the balance of power and all of these things. Like, what, like, bro, like, I hope they just completely, like, I hope they pop off tomorrow, man. Oh my God. What you said makes sense about a man drinking wine in the morning. No, the thing is, that's just word, just a field of study. It's in the law. It's literally laws like that. Violence Against Women Act. Yeah, I think there is the thing is, I think everybody should get a fair shake. That's all I'm really trying to get at here. And the fact that they just let that happen, I think, is a disgrace, man. It's her witness. Of course she's biased. You fucking daft. The reason, okay, so here's why I'm there's a difference between being biased towards an individual and being biased on a general level. She is biased on a general level. And also, we didn't even know that she was her witness and that she had any interaction. By the way, we went through a 3-hour interview of this bitch, and we don't even have a single fucking a single bit of information if she ever got paid or got any sort of quid pro quo from Amber. She's a bitch. Like, she does this, like, I'm sorry, but, like, if you're gonna come up here and use that fucking language under oath and do this alliteration performative bullshit, you are a lying bitch. And, like, that's all there is to it. And the ASLU brought you? Yeah, it's disgusting, man. I fucking hate that shit. Yeah, I'm so absolutely fucking tired of it, man. I really am. And it's just stalling. Like, I can't believe this, man. I cannot fucking believe this. It's just, it's too much, man. Yes, she did claim a lot of the unproven. Outside of any of them, first evidence is important. Yeah, I think so too. Professional witnesses get $500 an hour, sometimes $1,000 an hour, so there's that reason. Yeah, but there was never even a question. There was never a question as to whether she received any compensation from Amber Heard. Don't you find that odd? And don't you find it odd that her relationship with Amber Heard was only disclosed after she had created parameters that were gender exclusive about the relationship between the two of them? Don't you find that interesting that it's done this way, and also at the same time no other witness and no other person up on that stage had that happen? They immediately had it disclosed regardless of who actually was interviewing them. But this one is different. Why is this one different? Because they're a trying to push a specific narrative. The beginning of it, they were trying to create the initial narrative that it was a man and woman thing, and that's why even not only was she doing it, the woman on the stand, but on top of that, it was also the lawyer that was baiting the gendered responses as well and using the exact same language to get her talking in that field, because that's what people are going to passively assume. I'm so fucking sick of this shit, I can't even believe it. It makes me sick to see this, because here's the fact, is that this piece of shit has done the same thing for what she even said at least 50 other court cases in the past. So how many other lives has she ruined because of her biased fucking perspective on things? I can't believe this. And that's what's so fucking annoying about it, is it has nothing to do with any of this other stuff. It has to do with the fact that Johnny Depp is probably going to come out of this ahead. He will probably come out of this ahead, even if he doesn't win a defamation lawsuit. It doesn't really matter, because Amber Heard's career is over, and that's pretty much it, right? But the fact is that this person will live to fight another day. That they will continue with their career, and they will continue to destroy people's lives based on an ideology and not a reality. And that's what I think is so fucking disgusting. Do you see what I'm saying? I'm so fucking pissed off about this. I really am. It's an absolute fucking disgrace. And I'm glad to see literally everybody thinks the same thing, basically. Like, I'm reading the comments, I'm seeing the sentiment in chat, I'm seeing what everybody is saying. Everybody thinks this. Everybody feels this way. And thank God for that. It's so obvious she's full of bullshit. Exactly, man. Like, I'm so upset and I'm so mad, but hopefully the jury does too. I think they do. I think especially whenever she started going on the rants. You know, she started, you know, auditioning for a role. I think that it became very evident what the what the goal was here. Let me just say that for sure. Do you think Johnny's going to win? I have no idea if he's going to win defamation. It's pretty hard to win defamation. I have no idea. In my opinion, I don't think that he probably will, because especially since Amber Heard was diagnosed with PTSD, she has plausible deniability for not basically delivering the accurate information and having it not actually be perjury. So I consider it unlikely that it will happen. However, it doesn't really matter. Like, Johnny Depp doesn't need the $50 million. It's not about that. It's like, if he loses the case, everybody is going to think that he should have won. Yeah, he already has won in the court of public opinion. But you know why he's won in the court of public opinion? Because of the fucking evidence. Because the evidence implicates Amber Heard as being violent, and there are literal scars and pictures and videos of this happening. Yeah, because of the actual facts. Like, I'm not going to listen to, like, oh, wow, Johnny's friend says he's a nice guy. Oh, I would have never expected that. But whenever it's backed up by actions and other things like this. Meanwhile, it's like, let's think about this in context, okay? So we learn more about Johnny Depp, and we find out that he actually had a friend that he, you know, wanted to become his patron and helped him, you know, become an artist and sell his work and create a body of work and really, you know, live out his dream. We hear more about Amber, and we find out what's more about her. We find out that she was abusive to her her past boyfriends or girlfriends, and that she also has video evidence of her hitting her sister, right? So it's this weird thing where the more that we learn about Johnny, the more that we learn that, yeah, generally he's a pretty decent guy, right? I mean, this is what everybody says, and these are things that were not overly publicized. Oh, and by the way, Amber Heard also tried to steal money from kids in the hospital too, the charity thing. So it's not just like one thing, and like, so you're, oh my god, it's just, the more that we learn about him, the more innocent it makes him look, and the more that we learn about her, the more guilty it makes her look. Tried, she stole them. Yeah, I know. PTSD doesn't mean it was mutually abusive. She lied about it being one-sided, and his career suffered. Well, it's obvious that her language and her words caused Johnny Depp to lose roles. Like, it's just obvious that that's what happened. I mean, what do you think? They were just gonna not have Jack Sparrow in the next Pirates of the Caribbean? He just randomly got dropped from playing fucking what's his name in Harry Potter? Grindelwald in Harry Potter? No. Absolutely fucking not. It's because of what she said. yeah, it's just Same shit about Thrones pay to win. Doesn't matter what you think. You're not going to win. Men will still be fucked. No, it's not true at all. I think that a lot of guys see this, and I think that more and more people, and I think it's women too. Women are seeing this, and the fact is that, like, this will damage women's credibility in general. It will. And it shouldn't, but it will. And this is something that all women have to suffer for now. You understand? Like, this is something all women now have to suffer for. And also all people like, that are related to those women, right? Because it's like, it's not only like, well, let's say your sister is getting abused, or your mom, or, like, you know, a good friend of yours is getting abused. You know, this affects you too, right? It sucks to be in this situation and to know that she can't get any help. So there's a ripple effect from this. There is. And it's just so, what about Johnny Depp's PTSD? I don't know. Yeah, I'm not sure. With her being diagnosed with PTSD, should her be disqualified as a reliable witness, therefore be cut out? I have no idea. I'm not sure. This is something Amber Heard would ever see any success with? I don't know, man. Financial damage probably way worse than what they're even claiming. You never know what opportunity could have come along without this shit. Yeah, exactly. I totally agree, and that's why I was glad to see Johnny Depp. You know, he said he's never going to work with Disney again. Thank fucking God for that. Yeah, thank fucking God for that. That's exactly what I think he should do. Why ever give that even a second's worth of effort or information after that bullshit, man? Fuck Disney. Yeah, fuck Disney, man. Psychologists should have her license revoked. They're supposed to be non-biased, but the woman is clearly biased and she doesn't deserve to testify. I don't know about getting her license revoked. I'm not sure what the process for that is. I don't know. But, like, it's very clear that in her mind, men are the abusers and women are the victims. And I find it incredibly dangerous that a person like that is in a position of power where they are being given the autonomy to make decisions and delineate guilt and fault. I consider that to be very, very worrying. They're throwing sexual abuse around a lot because the public falls for that shit every time. Nobody's falling for it. That's what's so good about this, is that actually nobody is falling for this. And I was looking at the at all the information on Twitter and everything like this. Literally everybody thinks it's bullshit. Yeah, it's like I'm reading like all of the public sentiment about it, everything about it. They all think that it's bullshit. And they lost hundreds of millions, so people will fall for it. It doesn't matter. See, like, here's what you have to understand, is that this individual case doesn't really matter. What matters is the cultural impact of it. Whether Amber Heard goes to jail or not, whether she is considered guilty or not, whether Johnny Depp gets $50 million or not, these don't matter. What matters is the cultural impact and the way that this will change the way that the public perceives interpersonal relationships. It's a means to an end. This is simply only one point on a graph, if that makes sense. Yeah, you gonna play Vampire Survivors? Yes, I will play Vampire Survivors in a bit. Probably actually pretty soon here. I just want to. I'm gonna continue ranting about this for a little bit longer. The witness is an extreme weakness to me. You can use her to bolster a statement of trial, but not to carry it. I would have never started with it. What a disgrace. Yeah, I think so. And I like how she said it's just to post it, then proceeded to pull out literal folders of documents as her notes. Well, it was very evident to me. Like, I don't feel like the notes were indicative or they were incriminating at all. It was very obvious that the witness had no real idea. Like, she didn't understand the context behind it and all the other names and dates and everything, but she had a very good understanding of, like, what, you know, her and Amber had talked about. And I think that makes sense. So I don't care what she's if what she's doing is written down. I care about what's written down. That's what I'm saying. Will it change anything? I doubt it does. It does not fit into Meets Your Views, so it'll get buried and ignored. Does this look like it's getting ignored? Let me ask you something. Does this look like it's getting ignored? No, it's not. There are literally hundreds of thousands of people watching this. There are tens of millions, probably hundreds of millions of people who are keeping up with this. This is not being ignored at all. This is one of the biggest stories since, like, O.J. Simpson. Like, it's fucking massive. Nobody's ignoring this. It's huge. I could see extreme bias helping the prosecution paint her as an unethical professional, and I cannot wait for that to happen. I'll say that for sure. Yeah, OJ's still free, doing whatever he wants. Yeah, after he did jail time. Like, he got convicted, and he did jail time. Like, that's what happened. I'm pretty sure he did jail time. Didn't OJ Simpson do jail time? Yeah, I'm pretty sure, yeah. Not for murder, yeah, but no, but they got him for something else, exactly. And so, yeah, for burglary, yeah, for a different crime. Well, it's harder to convict, right? And this is just what happens. And you can see how the legal definitions of things are, it's like, oh, well, she wasn't a client. And it's like, technically this is true, but in the layman's understanding of what a client is, it was obvious that Amber Heard was effectively a client. Any normal person would look at that relationship. An average person would look at the relationship between the two of them and assume this was a client. This was a client of this witness, right? And I think, yeah, if the glove fit, yeah, exactly. And so what I'm really trying to get, yeah, shit on his bed. Yeah, she literally shit on the guy's bed. She seemed to give Amber's testimony to her. I don't really know what this is. I have no idea. Not a client, just a paying patient. Yeah, it's just it's so obviously delusional. It's so obviously fake and misleading. It's very frustrating for me to see this. It's really, really annoying to go through, man. And I don't know. I have to ask about your legal knowledge, expertise. I was actually going to go to law school. I was in a business school, and I dropped out. But yeah, I was originally going to go to law school. I took a few classes in it, obviously, but you know, I don't have a law degree. No, I don't. Or she heard the story and willingly took her on. Yeah, but I mean, I think that at a certain point, if you're saying the person is not a client, I feel like this is an intentional obfuscation. And I think that's really that's probably the best way that I would describe all of this, is intentional obfuscation. What is being said is clearly not what makes sense. Like, what is being said is clearly it's clearly misleading. It is intentionally misleading to the point to where you want somebody to think something that is not true. And that's what I think the biggest difference is. It's manipulating reality. Yes, exactly. It's very frustrating for me to see this. The overwhelming majority, I'm talking like 95% of people, are on Johnny Depp's side. Like, they are completely on Johnny Depp's side. And I think that, I actually think that people like this woman here, I think that people like her actually hurt Johnny Depp more, or sorry, hurt Amber Heard more than they hurt Johnny Depp. Because the way that she talks, like, it's just so obvious that this person is biased. It's so obvious that this person is intentionally trying to be misleading. It's like people see something like this and it just looks like a bad actor.